All right. It is Thursday, September 19th at 9:07 a.m. The board meeting of the Oregon State Board of Nursing is now called to order. A notice of this board meeting was published by Rachel Prusak, Executive Director, in accordance with open meeting law. If necessary, the board may also meet in an executive session as authorized by ORS 192.660 sub 1, ORS 192.660 sub 2, F, H, and L, ORS 678.126, ORS 676.165, and ORS 676.175 sub 1. Board members and staff stating that they are present are attesting to understanding the confidentiality of executive session and have taken steps to ensure that executive session proceedings are not observed or heard by anyone not authorized by public meetings law, ORS 192.660. Is there a roll call by our secretary?
Yes. Aaron Green.
Here.
Linda Stanich. Here. Margaret Hill, present. Claire McKinley Yoder.
Excused.
Joni Callis.
Present.
Marcus Cooksey.
Present.
Michelle Chow.
Present.
Oleniki Toabola.
Here.
Yvonne Yanduan.
Excused.
There being a quorum present, I declare this board eligible to conduct its business.
Is there a staff roll call?
Rachel Prusak.
Here.
Lauren Rauch.
Present.
Aaron Ferris, present. Brittany McCormick.
Present.
Phil Young. John Etherington. Brandy Ritter.
All right. It is now 9:09 a.m. The Oregon State Board of Nursing will now meet in executive session to consider information or records that are exempt from public inspection, including advice from legal counsel, and to consider information obtained as part of an investigation into a licensee or applicant's conduct. This executive session is held pursuant to ORS 192.660 sub 1, ORS 192.660 sub 2, F, H, and L, ORS 678.126, ORS 676.165, and ORS 676.175 sub 1. Members of the news media may remain during executive session, but are directed not to report on, record, or otherwise disclose any of the deliberations or information discussed during executive session. If you are a member of the public, please note that the public video stream will be unavailable during executive session. No final action will take place in executive session. At the end of executive session, the board will return to public session for the purpose of taking formal action on matters discussed in executive session. While the board is in public session, the public video stream will be available. It is estimated that the executive session will end at 9:30 a.m.
It is now 9:31 a.m. and the Oregon State Board of Nursing is still meeting in executive session. The new estimated end time of executive session is 10 a.m. It is now 9:58 a.m. and the Oregon State Board of Nursing is still meeting in executive session. The new estimated end time of executive session is 10:10 a.m.
All right. It is now 10:09 and the board will now exit executive session. It is 10:09 and the board will now meet in public session for the purpose of taking formal actions on matters discussed in executive session. Is there a motion?
Like to wait for.
Yes, we should wait for Nikki to come back.
Board want to take a 5-minute break?
Yes, let's take a 5-minute break. Is there a motion?
Okay. Based on the evidence presented in case 2024-05-0070 to grant reinstatement of the license.
So moved. Second.
Been moved and seconded. All those in favor say aye.
Aye.
Aye. All those opposed? Recusals or abstentions? Motion carries.
2023-08-0044, 2023-090158, 2023-090202, 2023-100102, 2023-100228, 2023-110033, 2024-010235, 2024-010276, 2024-020237, 2024-020268, 2024-030095, 2024-030156, 2024-030283, 2024-040201, 2024-060134, 2024-060104. The cases be dismissed.
So moved. Second.
Been moved and seconded. All those in favor say aye. Aye. All those opposed? Recusals or abstentions? Motion carries.
Based on the evidence presented in case 2023-100029 to withdraw the notice of proposed reprimand and dismiss the case with a letter of concern.
So moved. Second.
Been moved and seconded. All those in favor say aye. All those opposed? Recusals or abstentions? Motion carries.
Based on the evidence presented in case 2023-110211 to withdraw the notice of proposed civil penalty and dismiss the case.
So moved. Second.
Been moved and seconded. All those in favor say aye. Aye. All those opposed? Recusals or abstentions? Motion carries.
Based on the evidence presented in case 21-00281 to withdraw the stipulated final order of reprimand.
So moved. Second.
Been moved and seconded. All those in favor say aye. Aye. All those opposed? Recusals or abstentions?
Abstain.
Abstain.
Motion carries with 2 abstaining. See. Later. It was. They don't have to sit in the gallery.
You're just here.
Oh. Don't worry, they're wireless, so we could bring it to you.
No, we have big chairs and little chairs.
I got a copy, unless there's more than two people on it. Okay. All right. This everybody? All right. I will call our public meeting to order. Guess I need to read my public meeting script, huh?
Recording in progress.
Mhm. Do I need to redo the entire public meeting script? Yeah. Okay. That's okay. Mm. Okay. I'll do the script and then we'll just skip down to the staff roll call. It is September 9th, Thursday, September 19th at 10:26 a.m. The board meeting of the Oregon State Board of Nursing is now called to order. A notice of this board meeting was published by Rachel Prusak, Executive Director, in accordance with open meeting law. If necessary, the board may also meet in executive session as authorized by ORS 192.660 sub 1, ORS 192.660 2F, H, and L, and ORS 678.126, ORS 676.165, and ORS 676.175 sub 1. Board members and staff stating that they are present are attesting to understanding the confidentiality of executive session and taking steps to ensure that executive session proceedings are not heard or observed by anyone not authorized by public meeting law. ORS 192.660. Is there a staff roll call?
Yes, thank you, Mr. President. I will ask to go around the room for our staff to announce themselves and for our public to announce themselves. I would love to start over with the policy analyst. If you could please kick us off, Barbara Zhu.
Policy analyst for nursing assistant, education and assessment.
Gretchen Cook, Policy Analyst, RN, LPN Practice Board Staff.
Sarah Wickenhagen, Policy Analyst, Advanced Practice Nursing.
And Laura Blackhurst, Policy Analyst for Nursing Education.
Kimberly Goddard, Chief of Staff. Lauren Rauk, from the Department of Justice, Attorney for the Board.
Rachel Prusak, Executive Director. And now I will just ask the few public members that are present to introduce themselves. And last, but certainly not least, I would love for Brandy Ritter to announce that she is here supporting the board.
And we have one more.
Public? Didn't realize you had, okay.
Distinct, Bill.
Thank you. We love our new mics. I look forward
We
to
do.
seeing if there's anything more to improve. And Brandy.
All right. Are there any additions, modifications, or reorganization to the agenda?
Yes.
Mr. President, we are going to be pulling PR1. Policy analyst Gretchen Cook.
I might not see.
There it is.
Oh, 10. Okay. All right. And then we have, there any additions to the consent agenda? Or do we have approval for the consent agenda, I should say? Yes, I can. The consent agenda
Consent agenda.
to be approved.
You always do.
I know. I make a motion that the consent agenda be
Yes.
approved as presented.
So moved.
Second.
Been moved and seconded. All those in favor say aye. All those opposed, recusals or abstentions, motion carries. All right, I make a motion that the board meeting minutes for June 12th through 13th be approved as, oh wait, I should ask, are there any changes or alter to the June board meeting minutes? I make a motion that the June board meeting minutes be approved as presented.
So moved.
Second.
Been moved and seconded. All those in favor say aye.
Aye.
All those opposed, recusals or abstentions, motion carries. We have July's board meeting minutes. Are there any changes to the board meeting minutes for July? All right, I make a motion that the board meeting minutes for July 17th, 2024 be approved as presented.
So moved.
Second.
Been moved and seconded. All those in favor say aye.
Aye.
All those opposed, recusals or abstentions, motion carries. All right, we have August 14th, 2024's board meeting minutes. Are there any changes to discuss? All right, make a motion that August 14th, 2024's board meeting minutes be approved as presented.
So moved.
Second.
It's been moved and seconded. All those in favor say aye.
Aye.
All those opposed, recusals or abstentions, motion carries. We have August 26th, 2024's board meeting minutes. Are there any changes to those board meeting minutes? Okay, hearing none, I make a motion that the board meeting minutes for August 26th, 2024 be approved as presented.
So moved.
Second.
It's been moved and seconded. All those in favor say aye.
Aye.
All those opposed? Recusals or abstentions?
Abstention, I was absent.
Motion carries with one abstaining. That moves us on to policy analyst Barbara Zhu.
Good morning, Mr. President, members of the board. Thank you. Good morning, Mr. Yes. Lovely technology.
You can
Yes.
unplug it from the charger.
Can you hear me? Yes. Okay. Good morning, Mr. President, members of the board. It's my pleasure to present to you my agenda item. It's on page 103 in your packet. And this is on proposed revisions to OAR Chapter 851, Division 62, to add the language in 0052 that was inadvertently deleted after the final approval adoption at the September 2023 board meeting. At the May 2024 meeting, board approved the temporary adoption of this. So requesting for this to move to the public hearing.
Board members, any comments or concerns or questions? All right, hearing none, I think we're ready for a motion on it.
Mr. President and members of the board, request that board staff move forward to administer rule hearing for OAR 851-062-0052 as presented.
So moved.
Second.
It's been moved and seconded. All those in favor say aye.
Aye.
All those opposed? Recusals or abstentions? Motion carries.
Thank you.
All right. I believe that moves us down to policy analyst Laura Blackhurst.
Good morning, Mr. President and members of the board. So I would like to direct you to page 106 of the packet. And there you will find a memo describing proposed rule changes to Division 41, Rules 0020, 0030, and 0080. As I shared in the memo, through Director Prusak's statewide listening tour, we heard feedback about the nurse intern role and challenges and barriers to the utilization of the nurse intern. The feedback that Director Prusak received, I think, really mirrored our own analysis of the rules and challenges with them. And so the proposed rule changes in your packet are intended to remove barriers to getting licensed as a nurse intern, clarifying that a student only needs one term of a nursing program with a clinical experience prior to applying for a license. The longer renewal cycle, we believe, will not only ease the licensing process for students, for program directors, for OSBN staff, but because we're not tying the license to a term by term program enrollment, these students who are nurse interns can then actually work over the summer, where they actually have more time and opportunity to work as a nurse intern. And then the final change is that in lengthening this license, we wanted to clarify in rules that if a student has something change in their enrollment in a nursing program, that they have a duty to report that to us. So I'm happy to answer any questions or take any feedback on the proposed rule changes.
Board members, I do want to say thank you. You guys put in a lot of work between Director Prusak going around the state, listening and hearing from all the different people weighing in, and you guys giving all of our nursing students the opportunity to actually work over the summer when most of them actually have free time and aren't weighed down with school. And all the work you guys have put into this division. Other board members, any comments or questions for this division?
I will add, if it's okay. I'm
Absolutely.
so thankful that we're having this discussion. I think one of the things that we keep talking about is what are the barriers that boards of nursing, regulatory boards have to protect the public, and what are the unnecessary barriers that keep us from having the laws and the rules actually be implemented. And going to Eastern Oregon, Southern Oregon, and the coast, those that have implemented the program did so despite the many challenges, and shared the requests for what little tweaks could be added to our rules. And I heard this universally. With that, some still implemented it and got through the barriers, but it was a lot. And these barriers included, can they work during the summer? How much does the dean have to be involved? Where are the students' ability to own their role. I got to meet some of the nurse interns that were actually working while we did the tour, and it was very exciting. And I'm sure we'll hear, hopefully, when we hold the rule hearing after this, from some of them. But it is going to really support our workforce, support our students, and really go back to what the statute says that this is supposed to be.
All right.
I had a question for clarity. I feel like I've read it 3 times and my brain's not adding it together. The part where it says student could not be licensed over a summer break, so they can only be licensed during fall and spring, regardless if they're taking summer classes. Like if they failed a class and they had to retake a class to make up for that year cycle, it wouldn't matter.
Thank you for clarifying that. So the rules as they currently are is that the license is related to your enrollment in the nursing program. And so I think if the student was able to take nursing courses over the summer and they were still in good academic standing, that potentially they could have worked as a nurse intern. However, I know that a lot of our nursing programs don't offer courses over the summer, especially if it's like a one-off for a student or two who maybe didn't pass.
Thank you.
Other board members? All right, I think we're ready to hear a motion.
All right, I motion that the board approves OAR 851-041-0020, 851-041-0030, and 851-041-0080 to move to rule hearing.
So moved.
Second.
Moved and seconded. All those in favor say aye.
Aye.
All those opposed? Recusals or abstentions? Motion carries. All right, we're a bit ahead of schedule. Do we have the schools here to move into schools?
We do not have the
Okay.
nurse.
I would
administrators.
say if there's anything that we can move around, it's probably me. Like I've done in the past, so let me just give me 1 minute to see where we pick up on. What time are they coming? What time are they on the agenda?
They are on for after lunch at 1:30.
Oh, well, then I'm going to be able to do probably all of my things. If that's really all that's
Yep.
between us and lunch.
We finished the morning agenda.
Okay, so I'm going to come over there and you all will be patient with me. And yeah, let me just take a 5-minute break and ultimately we're going to get out early today because of all of this. But there were a few things that I thought that I was going to work out at lunch that I just need a few minutes to work out right now. And then we'll just present all of my stuff to you.
10 minutes. We got
Okay.
plenty of time.
Okay.
We're going to take a
10:55?
10-minute break. We'll be back at 10:55.
Thank you.
Director Prusak's presentation. It should start on page 180.
Good afternoon, Board President and members of the board. So I'm gonna be talking to you about a few topics over the next, hopefully, no more than hour. Starting with the increase of fees during the 2025-2027 biennium. I have our fiscal manager with us, just in case there's questions that I'm unable to answer. So, when I arrived and witnessed caseloads double what is considered manageable and a backlog in our investigation department, I recruited DAS to review the agency structure. And the state determined that OSBN investigation department needs additional positions and management restructuring to align with the state manager to staff ratio. This restructuring plan will not only alleviate the current workload, but also ensure that we can continue to provide timely and effective services in the future. The additional positions and reclassification will not only reduce the backlog in caseloads, but also improve the quality and speed of our investigations, ultimately enhancing the protection of the public. A proposed $100 application fee increase is necessary to ensure the OSBN's financial stability as costs have increased beyond our revenue capacity. It's essential to understand the financial strain our agency is under. Our internal costs and expenditures have risen significantly, $9.5 million, that's 57% in the last 5 years, $14.4 million, 97% in the last 10 years, and $15.8 million, that's 119% since the last fee increase since 2009. Over the previous 15 years, the agency has increased by 14 staff positions and must add more to keep up with the workload. This financial burden underscores the necessity of the proposed fee increase. For this to occur, the board must vote to modify OAR 851002 licensing fees to increase RN LPN renewal endorsement, reactivation, reinstatement, and initial exam applications. The board receives an average of 77,266 applications per biennium. The board must also consider a modification of OAR 851002 licensing fees to increase all NP, CNS, CRNA renewal and initial application fees. The board receives on average 7,047 applications per biennium, and if OSBN increases fees by $100, it will provide the board with revenue of $704,700 per biennium. As the board considers the proposed fee adjustments, it's crucial to maintain a commitment to fairness and balance. Oregon's nurse license costs are significantly lower than neighboring states, as Washington and California. For instance, Oregon's license renewal fee is $145 every 2 years, compared to Washington's $138 yearly renewal fee, and California's $190 every 2-year renewal fee. Similarly, Oregon's exam fees are currently $160, while California charges $300 and Washington $203. By increasing OSBN's license fees by $100 for each RN, LPN, and advanced nursing license application type will align Oregon's fee schedule with our neighboring states, ensuring a fair and balanced approach. Our mission is to protect the public, but it can only be successful if the investigation department structure is updated and nurses maintain access to the Oregon Wellness Program and the Alternative Discipline Program we'll be talking about a little later today, HPSP. Therefore, the proposed increase in application fees is necessary and a means to uphold our mission. The estimate $1.5 million increase in expenditures in the upcoming biennium is a worthwhile investment in safety and well-being of Oregonians and to uphold our mission to protect the public through regulatory excellence and promoting the wellness of our nursing professionals. On that, I know I mentioned we will make a motion and there'll be a modification to that motion of just the kind of the process that happens as the board really more ratifies this discussion around an increase, but it's really then the proposed budget that John Etherington and I worked on with the governor's office. Once that's approved and it goes to the legislature, then we come back and do the rule modification. Today is really just that, ratification that the board approves that next step.
Board members?
We all look at each other. Thank you very much for this. I'm not surprised, especially considering how hard everyone around here works, and I'm only here once in a while. So my question to you is, when DAS came to review the agency structure, did they have a recommended FTE count?
They did, Mr. President and Board Member Chaos. They were surprised that we didn't have more managers and supervisors. Therefore, currently, as you know, investigations manager Erin Ferris has been managing an entire department. And so adding another support manager, and we have gotten the approval. We have done the interviews, we have made an offer, and the goal is for them to start October 1st. So that is one of the biggest things that I think is really going to right-size the department. And then knowing the workload and the caseload is adding 2 more investigators, a nurse investigator and an investigator 3. Mhm.
Thank you.
I had a few questions, and I am horrible with math, so I need to say that first. When was the last time the fees were increased?
That is a great question. Board members, 2009. And so when I looked back at what other boards have been doing, they have been asking for increases all along. We're one of the few that have not. And during this discussion, what was interesting, the difference of how it impacted somebody, like to know the scale that has changed as far as what our staff gets paid, especially since the recent pay equity. And that includes our staff legal counsel. Like everybody gets paid a lot more now than they did then. But also one of the ways that I chuckled was when people made the comparison of how much a burger was at Burger King then compared to now, that it really shows. I think it was like, several, you probably don't remember either.
They used to have a $1 menu.
Yeah.
Mhm.
Yeah.
You're not anymore.
Yeah. And so, it's a very, interesting topic to have a conversation now, knowing what nurses are going through. But again, we need to do this to continue to provide the services that we're providing and uphold our mission. But 2009.
So in 2009, when it was increased, by how many percent was it increased?
Board president, members of the board, I don't have that information off the top of my head. I want to say it was just increased by like $15 or $25 last time. One of the internal discussions and how we set it $100 with the LFO and CFO's office working with the legislator is they didn't want the Board of Nursing to have to come back or really change fees within the next 5 to 10 year structure. They don't want agencies every 2 years trying to go back and ask for for these price increases. So they really wanted us to look at the future and say, what is a good number? What is a good amount that's going to set you up for the next 5 to 10 years in this biennium, so we don't have to repeat the process. So that is why it's the $100 insignificant increase right now from what it is because they didn't want us to do $25 or $50 increments like other boards have done in the past. So that was a significant increase. We know from what it currently is now, what it's going to be. But that, as Rachel said, also does align us with the West Coast states and what they're like.
Yeah, and I'll add, in 2009, why it was increased was we joined forces for money to go to Oregon Center of Nursing for us to be able to have our data, and for HPSP to include a third-party vendor since we were unable to do it within the office anymore. And then I think I can get you the exact number, but as John mentioned, the reason why we did $100 is we did 50, 75, and 100. And the way that we were going to maintain all of our services and not have to continue to add another increase in the near future, which we're seeing a lot of agencies having to do again this year after only doing it a few years ago, is the big thing. And I think one of the important things to share with you all, and maybe some of you already know this, I'll admit it was something that was part of my learning curve, is we have this money in our budget from licensing fees. We just had to have the approved process to release more money for us to continue. Does that make sense? And I don't know if it can be explained differently by our expert, but that's why we need to go and reconcile it through the entire legislative process.
And if I remember right, the fee increase in 2009, it was pass-through fees. They didn't actually come to the board. Like, part of that went to the fingerprint fee that went straight to the state.
Yeah, board president, members of the board, there have been other fee increases, like $1 for a fingerprint fee. There was the change from the workforce data fee from $5 to $4. So there were just house cleaning fee changes within that 2009 period. I believe the OCN fee was one of those when we had a legislative mandate to create this fee, this fund, and start transferring expenditures that way instead of kind of a revenue pass through how it used to be. But as far as the actual application fees themselves, they haven't been.
Yeah, and sorry for clarification, 2009 was HPSP, 2015 was the added kind of surcharge for Oregon Center of Nursing. And this isn't adding a surcharge, it's the application fee, very different.
I have two more questions. I am not good at math. So by increasing by $100, how many percent, what percent increase is that in math from current fee?
Probably have it.
Board president, members of the board, being depending on what fee application you're talking about, if we're just talking about renewals, so if it's going to be 158 compared to 258, you're looking at about, yeah, a 60% increase over this. So it's not going to quite double, but it will come up significantly for that one. For initial exams, they're a little bit expensive at 160. So that would be a little bit about 50% rather than the 60, but it's going to be between the 50 to 60% range for these applications at what they're currently priced.
Okay. The reason why I ask in percent is most of our workforce that we focus on get increment on like the salaries and stuff based on percentage increase. And I appreciate the explanation behind other boards might be doing this like pretty often, but I'm also looking at the aspect of like, it's easy for you to add $1 to the gas prices this month. And I don't feel the pull so much in opposed to adding $4 to the gas prices. And I feel the effect so much. I feel like you might have answered this question of why we're not going for incremental increase in opposed to just all in it at once, which might be a lot more for people and they might feel the effect more.
I mean, I think the biggest thing is I didn't get here till last year to promote this, and it hasn't been done since 2009. And so we're making up for adding, as I said, 14 staff, and nobody's ever asked to do this. So other agencies, as they add staff or as they right-size their structure, had been doing this. I now have the opportunity to lead the agency to be right-sized and actually I mean, it's not an easy conversation, and I think sometimes people don't like to have hard conversations. And I'm not going to shy away from them because it's what's right for our agency. It's what's right to protect the public. It's what's right for our nurses. And so I think, unfortunately, we're having to make up for not doing it since 2009.
So just like board member Jonah Callis had asked, are we planning on adding all this FTE at once, or are they going to be incremental?
It will be incremental. So this is investment also into our future FTEs. So the ones that Rachel talked about are the ones that are coming up in the current biennium budget. But as we look back in last budgets, and she's referenced those 14 positions, every 2 years, it seems pastly we've been looking to add more positions. So this looks to the future and kind of takes those into account too, that in the future, we'll still probably need to add additional positions and not at that time try to increase fees and chase some of these expenditures as we add them. This fee will kind of already make that investment into the future for those additional positions that we will probably need in the future, and any additional expenses that we may have in the future. And that way we don't have to come back in the future and ask for another fee increase of
Thank you.
I think another good thing to think about here with the upcoming talks that we've been talking about, getting back into HPSP and the costs associated with that, this fee could help potentially allow us to afford that cost without having us add on an additional surcharge onto each license type to cover HPSP as well, or whatever program we decide to go back to. So that's another way we can look at it, because we're reinvesting not just in the board and the board staff, but in the public and in our people that we're representing here at the board.
Questions, one related to what President Green was speaking to. With the projected increase in revenue of around 7.7 million per biennium, do we have I imagine you probably did a lot of calculations to come up with that number. Like, what percentage is dedicated to the need for investigatory staff versus what percentage would be towards Oregon Wellness Program and HPSP potentially? Or was that, how much of that was planned in?
So board president, members of the board, how we do budget is we're just in one big fund, so they don't have budget allocated to anything percentage. I think as the board president was saying, as we reinvest in HPSP, that is obviously going to drive our expenditures and what we need for our one fund to run the agency to increase. That is just one of the aspects of probably all our expenses that are increasing for the board. As we've mentioned, the cost of living's gone up for staff salaries, electricity expenses, just all board expenses have gone up since 2009. So a lot of that's also investing into the future things that will kind of go up that we know that will increase in our expenditures too. If that makes sense, which is kind of the HPSP program and making sure that we have significant money to invest where we would need to into that program instead of having to come back at a later time and trying to increase fees. If you're trying to chase those expenditures a lot, then you're having to make those adjustments on the fly when we're doing that. Whereas this one just looks kind of more forward into the whole board structure, how we're going to operate the board within the next 5 to 7 years. And that's how we kind of got how much are we going to need to operate the board in a total capacity. So not just for staff numbers or that, but also increases to other programs in the next 5 years.
And I'll add on in my non-fiscal manager brain is that I can't give the exact number of percentage of how it will be broken up because as John mentioned, what we prefer to do in the agency is have it be this pool. But what I can tell you is I can go back to the many, many, many emails and conversations we had with LFO and CFO about these financial decisions to make sure that we right-sized the department staff. But it was specifically percent of this was 3 positions for the investigation department, and the rest would be in the pool for decisions that the board makes with continuing to be able to support Oregon Wellness Program, continuing to be an HPSP. But the healthcare investigator, investigator 3, and support manager investigator were the actual positions, as well as reclassifying a few positions, which means as we worked with DAS to evaluate what was the structure of department needs for staff to manager, it was also are the classifications that we have, which are quite low level, the right classifications to support our work, and elevated those, whether it was our compliance specialists, our admin specialists.
I have a second question. About lumping together LPN and RN fees, and whether you're considering having a lower fee for LPNs, given kind of equity and lower income that LPNs make.
Trying to see what they are now, because there's so many.
Hmm.
I mean,
Board President, members of the board, that could be an option. They've always just been tied together,
Mhm.
I think, with the fee. So they're always similar. They've never had a difference. There's nothing that I guess would stop you or pertaining to make differences. I think they've just kind of treated them as the same, since I think they've always kind of had same policies and very similar. So they've always just kind of made the fee structure the same. So that hasn't been considered to lower an LPN fee, but we could take it into consideration if that's thoughts of the board.
Yeah, I would like to discuss that more with the board, and just especially when we're making this big jump, that we're being conscious of equity and that LPNs, are a different population than the RNs.
I unfortunately I don't know. I mean, I have the budget process has to be done now for the LFO and CFO and the governor's office to pass the governor's budget. It's not something that we can really amend today, unfortunately, but it's also the way we were able to not touch CNA. CNAs are not getting adjusted.
I'm director, is there so this is the existing schedule, is that correct, that you provided? Is there a proposed schedule that shows where exactly the $100 are going to be added to?
Yeah, so it's the $100 to the RN, LPN initial application and renewal application. And again, in comparison, we are much lower on both than every state around us, Washington and California. And even when we add this, we still are, because we're every 2 years and Washington is every year. And they have the same RN, LPN.
Will be more than California though, once we do this.
No. One of the things is a little bit more renewal, but not initial, not testing. Go ahead, Sarah.
Mr. President, members of the board, I have 2 questions. One, and I'm glad that we have legal counsel here and perhaps they can answer this question, but this is in regards to being an OCN board member. And so they have the $9 surcharge, and I think that is specifically in legislation. But that also has not been updated. And so if we ask for, would it be for us to ask that question that could be increased, or would that have to be, is it a different statute? I'm not clear.
It would be for the board to approve and for us to ask.
Okay, so just a thought that, it's sort of the same situation. It's $9 and that hasn't changed.
Yeah, but that's not in the proposed budget.
And that's fine, and that's why I'm asking the question, but I do think that the board should be made aware that potentially in the future that should also be revisited, because that is something that we do and has to do with our license fees, and that has stayed at the same amount since, what did you say, 2015? Right, so there's, maybe a percentage or something might be something to consider versus a very specific dollar amount, considering inflation and things. That was my first question. My second question was also, being transparent with salaries. Does this consider nurses and what they make, the going rate for nurses and the nurses that are employed by the Board of Nursing? Salaries are much higher in the field, and it's hard for us to recruit staff based on the salaries. And so did you look at that at all to make sure, or potentially provide salaries to nurses that work at the Board of Nursing that would be commensurate to working in a hospital?
One of the reasons that was presented was that every single staff had pay equity, and every single staff that was allowed for pay equity got staff increases. So staff, added staff raises, has put us in this position, and not a single person has come to the board or to the governor's office for their budget since 2009. All of these decisions are not made lightly. They are made over hours and hours and hours, and weekends and hours and hours and hours between myself and John Etherington and the financial officer, legislative fiscal officer, and the legislative branch. It's a very intense process. They question the two of us, just like you all are, to get to the place that we got to, and it includes very extensive questions to get here.
I do. I have a comment and then a couple of questions, but it might not be 100% on this topic. My comment is I moved here in 2009. I was pleasantly surprised that when I went to go get my license, that it was not what I was paying in another state or two, because I was licensed in a few. So that I actually have to agree with. My question is probably tagging on to yours. When we look at the future, and I know that no one wants to be delinquent in their, renewal process, but if there was a way to add on to that in the future. And then the last comment that I have is when we all go into the DMV and we get our license plates and there's that extra that I'll have the fancy one. At a certain time in my life, when I'm not at the point where I'm supporting children and they're all done with college now, would that be something that as a licensee, I would be willing to do for education or for that? And yes, it would be.
Yeah, so it's interesting because I believe it was Sarah Wickenhagen that had been, and maybe it was, I don't know who else. There were people, maybe NPO, others asking about this, how to have better investments in nursing. The problem is in the legislature is where you pass that, where you add onto the DMV, where you add onto license plates. It's in a very extensive process. It takes a legislator bringing forth a bill to do that, and that is not the role of the OSBN.
I really think this is a very important topic, especially with, it's a very hard topic, especially with the amount, but with the increases we need to see staff-wise with the backlog that the board's had for a long time with COVID and all the other backlogs that have happened, with us wanting to get back in HPSP, with Oregon Wellness, with all these programs we want to help fund. We don't have an endless supply of money. At some point, we have to find a way to support these programs, or we have to make the decision to say, sorry, we can't support these programs. And I think that's the point we're at now, is we're trying to make this decision for the next biennium of we're investing in the board and the members we represent for public safety, and are we going to take this tough decision and invest in rebuilding these programs, or are we not? I think that's kind of the question we have to ask ourselves. Because yes, it's a large amount, but we also don't have an endless budget either.
I think the thing for me, which I'm trying, and I keep saying this, I'm not good at math, but I like to calculate things in percent increase, and it helps account for inflation. Like in the next 3 years, what if some crazy thing happened and inflation is out of the roof? We're going to come back and do this again and again. In opposed, if we have a plan in mind of like every 3 years, we might increase by between this range and social range increase in percent, people don't feel the hefty lift, but they already know like every time I renew, there's probably going to be another extra $10 or $20, and they mentally just prepare for that.
Or are we locking in this $100 and saying, we're never gonna increase for the next 3 years? Or we can come back and increase again?
Board President, members of the board, the idea is to not come back and increase this for at least, 5 to 7 years, or hopefully further down the future. We've gotten 15 years at this point without increasing fees, and that's kind of what we want to do also in the future. I know there was also some consideration on whether these fees are refundable through people's employers. So we want to take that in consideration when doing these fees. I know it's a financial burden on a lot of people. Sometimes there are employers that will give you benefits or repay some of these. I know that doesn't cover all of them, but that's also trying to have them invest in the board, also invest in our future. One of the things I can attest to for the percentages, since the last increase, it's gone up 119%. So we've already seen that increase. Our increase, as I mentioned before, is that 50 to 60% range. So that's kind of, we're well below even predicting if we have maintained at this place where we would be hopefully in 10 years, if we have this 120%. So right now it's investment in the future. So even in 10 years, as everything increases, we can still maintain this level 10 years down the future when we think we're going to increase again by, this substantial amount. So that was kind of some of the offsetting percentages, as you say, too, making sure the fee increase percentage is high enough that it would offset these future, expenditures that we've seen have increased from 97% over the last 10 years, 119 over the last 15, and just 57% over the last 5. So even if we increase that 50 to 60%, given our past growth, that should give us to 5 or 6 years, hopefully, as long as we don't have additional increases or things that pop up, such as the pandemic or something again that really threw a wrench in our expenditures 4 years ago.
Thank you for elevating that again, because I went on and looked at just the percentage. I think I need to say to this board, I get the hard questions you're asking, and I am sorry that they didn't happen until today. These things should have been happening along the way, just like other boards were doing. Other boards are actually now having the hard conversations, and I'm talking about health professional regulatory boards, because I went through this intense process. We're having these conversations together because when the governor looks at their budget, it is, okay, why are all of these agencies asking for fee increases, application increases? But guess what? We haven't asked since 2009. So I can't make up for all of the years we didn't act, but what I need to do as the director is make sure that we have the resources to protect the public. And what that means is Oregon Wellness Program, HPSP, right-size our investigation department and ensure that our investigations are timely and thoughtful. Make sure that our nurses have access to the things that are offered to them and offered to our colleagues that are physicians, offered to our colleagues that are dentists, offered to our colleagues at the Board of Pharmacy. So yes, are we having to say in one lump sum, $100 maybe is a lot? I'm not going to deny that, but it's actually, and I'm just going to say it, not that much considering how long it's been since we haven't increased it. And I don't want to not do the right thing because before you as a board, before I was here asking, working with John, working with legal, legislative fiscal office, working with the governor's office to do the right thing. I don't want anybody to suffer because it is all having to be done now. And I just think it's where we're at.
One last short question. Would notification go out to licensee that this increase will be coming?
Yeah, great question. So I think you all know that one of the biggest things that I've wanted to do since I got here is increase transparency and increase communication. So this conversation has been had with a lot of people in the community to know that it was coming. And then if this does get through the entire budget process in the legislative session, which will, as you all learn, sine die will be sometime the very end of June. At that point is when we then come back, we open the rules, we have a process to vote on it again, and we will alert everyone. It'll be a conversation, a very public conversation throughout the legislative session, and a very public conversation of alerts when, if, and when it does happen.
Thank you very much.
Other board members, any questions or comments? I think this is needed. It is a large amount, but it's an investment in our future. And I believe we're ready to hear a motion.
Great. Thank you so much, board, for that discussion. Thank you for joining me. And the motion is a little different than as written, so I'm going to be very clear. But I'm going to make a motion to ratify $100 license fee increase for RN, LPN, NP, CNS, CRNA, initial and renewal application through the agency budget.
So moved.
Second.
It's been moved and seconded. All those in favor say aye. Aye. All those opposed? Recusals or abstentions? Motion carries.
We put it all. Okay. I have to make another motion. I did not mention endorsement, reactivation, and reinstatement. I only mentioned initial and renewal application. So I'm going to do it all in one again instead of two, but do it again if that's okay. Okay. Can I have permission to make another motion?
You may.
Okay, so I make a motion to ratify $100 license fee increase for RN, LPN, NP, CNS, CRNA, initial and renewal application, endorsements, reactivation, and reinstatement applications through the agency budget.
That need to say initial application.
So the first one was everything was initial and renewal for the entire licensees. And then it was the endorsements, reactivation, and reinstatement. But I can say it one more time. Yeah. No, it's okay. So making a new motion, everyone. I make a motion to ratify $100 license fee increase for RN, LPN, NP, CNS, CRNA, initial and renewal application, endorsement, reactivation, reinstatements through the agency budget.
So moved.
Second.
It's been moved and seconded. All those in favor say aye.
Aye.
All those opposed? Recusals or abstentions? Motion carries.
Thank you. Thanks. So, just another easy topic.
Yep.
Okay. I'm gonna take a sip of my tea, get a little bit. All righty, board members. So we've had lots of conversations about HPSP, alternative to discipline, many conversations over the last year about what it is, what it does, about board decision to not engage, and then what it would look like to re-engage. So just as a reminder, since 2002, OSBN licensees who have come to the board's attention with mental health concerns or substance use disorder have been facing a critical issue that they no longer have access to the Oregon's alternative discipline. Even those who attempt to self-refer have been denied. This urgent matter has been a crucial topic at our board meetings with board members, actively discussing re-engaging participation in HPSP, and most recently asking me to engage with the current vendor, Uprise, on what it might look like to re-engage. Since that discussion, I've communicated with Uprise, who still monitors 14 remaining licensees in the alternative discipline program. They understand that we are interested in re-engaging. They're excited about the opportunity to support the board's ability to ensure public protection quickly, while also dedicating time to engage with Uprise. I've been working closely with John Etherington, who you just heard from, our fiscal manager, to lead on work to request a proposal process. So as you also know, the current RFP for the next renewal with a third-party vendor is right now. It's actually a year ago from now, but the Oregon Medical Board, the Board of Pharmacy, and the Dental Board had asked for an extension in the hopes that the Oregon Board of Nursing would be re-engaging, and in that really be able to partner with the boards for another RFP process. So I ended up leading the work alongside John Etherington to do a statement of work for the next RFP process. And maybe I'll invite John back up to share where we're at in that process. But I know that the cost of testing has been a concern for you all. So I wanted to attach the cost of testing that is the fees for somebody in Uprise, somebody that has engaged in our alternative to discipline program, whether through a board referral or self-refer, and currently those 14 members are paying for. I also wanted to include the labs for those of our members that are on probation through Affinity. And then I also shared with you the monthly cost to boards for being in the program. And as you can see, the way they do the cost is 50% of how many licensees are in the pool, and then 50% of the cost is how many are actually engaged. And so this gives you an idea of what it looked like recently, where the Board of Nursing didn't have many participants since we haven't been engaged in it in 2 years. You know, and what happens to the other boards when a board isn't engaging is they're having to increase their pay per weighted payment for each licensee that's engaged. So that's a lot of information there. I don't know if you want to talk through what you saw, if you have questions about any of the lab tests. I'm not sure if I'll be able to answer all of them, but I can always come back with answers like I do.
So one question that sprang to mind, we're talking about enrolling the CNAs into HPSP. These costs are rather high. It would still be rather difficult for a CNA if they're having a substance use issue to do an alternate to discipline at these cost levels, and they would wind up failing out due to testing. Have we been able to talk with the vendor about ways to help CNAs and the med aids that would potentially be also enrolling in this program?
Yeah, Mr. President, members of the board, I know it's a big concern of yours and it's a big concern of mine. So, and why I wanted you to see very clearly the costs. Unfortunately, no. There isn't going to be an easy fix when it comes to the cost of testing, but I have a few ideas. And once we move along the process, think that I'm hopeful But the current research that I've been working on with the consultant I hired, the past Washington director of their HPSP program, and I have been reaching out to every state that's willing to talk to us. And there are very few that have CNAs engaged in their program. I think there are 8 right now that we've been able to talk about. And what I need to drill down into next, is it looped in the same or is it separate? And one of the things that I'm wondering as we move through this, and I don't have the answers, right? It's just part of the discussion, is are we going to have to do something separate?
Right.
And how does the conversation continue where once we are back in, once we do the education, once we partner with our hospitals, how does insurance get involved? And I think that's the real next big step of a conversation that has to happen. And I'm really excited to get to that step to be able to do it. I know that you all have presented to John Etherington. How is it that we could potentially have our certain funds go to support lab testing? It's been a big conversation that we're having with the compliance specialists as we recreate from fresh our probation policies, so that our probation policies are matching up with our alternative discipline, which is in the packet and up for another easy conversation after this one. So it is very apparent that it's out of reach of cost, and it's very apparent that not all states are doing it. Next on my list is to really reach out to Florida, because they've had CNAs engaged for a long time.
Good. One of my other questions is, I know this is something you've been working on, but getting the other boards in the state involved with HPSP, because having 4 boards support an entire program when there's many other boards in the state that would benefit from these types of programs.
Thanks for asking that. So while at the National Conference for Alternative Programs, had many conversations about how each state is doing this. And I wanted to bring this conversation to the legislative session next year. I was met with great resistance from the other boards for the reason that we just talked about in our last discussion, budget. So all of us were tasked with what it would look like if we had to cut our budget, and then all of us were tasked with what are our budget needs for the next 5 years to be able to sustain the level of services that we provide now, the staff that we have now, to not have to cut staff. And that's how we were all able to come up with our answers. With that, most other boards don't have 120,000 licensees, right? So the physicians, I think, only have about 20 something thousand, don't quote me. Their license costs are around 800. No other board has the amount of licensees we have. And so when I approached the 17 other health professional regulatory boards to start there was big pushback, and not because they don't believe in the program. They really believe in the program, just that their budget wasn't going to. So they had many fears when they heard that I was bringing policy forward to do that. With that being said, I've shared with you that we will be doing some statute updates, and at the next board meeting we can discuss exactly what those are, as we have been finalizing them. There is this discussion around how it could be that there is, and I know we just talked about surcharge and why we're not doing it, but how there could potentially be, and again, this is just all conversation, but that's what you're asking me, is how could there be a potential for boards could do a surcharge for this? And then that starts the boards and having those conversations. And then in 2027, potentially see more. Because what I saw was in some states, especially those that are umbrella boards, it's offered to all, and everyone gets a surcharge. But right now, the budgets of other boards, they were not able to participate in that conversation for this next biennium outside of the 4 that are in. And even with that, the dentists are having conversations of what can they afford. So I think the more and more that join, the better it is going to be. And we need to be a state that gets there. And that's part of the conversation next session, is how, because some states offer it for every single licensed board, plumbing, electrician, And so I'm hope Oregon can get there, but the start of the conversation is showing the boards that are in it, how do we improve the collaboration with our vendor, with our hospitals that benefit because the workforce stays, and potentially with insurance companies to help also. And then from there, my vision is to see other boards in it, and that does balance the cost.
I mean, if we get every board involved and spread it out, not just from health boards, but other boards, becomes significantly cheaper for everyone.
And protects the public.
Exactly.
And brings people to wellness. And, you know, one of the things that's so important for us to talk about is, you know, all of us licensed professionals are people too, and we should have access to things that our patients, those we care for, their families do.
And we often put our own health on the back burner when we care for our patients. Other board members?
I just want to clarify, you had said med aid, but they're not licensed med aid. So did you mean?
We have CMAs.
Right, but well, I'm just thinking of my industry of med aids.
I was talking about the CMAs.
That's what I thought. Okay. Can I just ask two questions on the 14 that are remaining? Is that because, number one, is this the only program, Uprise? And why? So I find that number kind of shocking. And then that there's 14 remaining. And then number two, a thought, because I'm always thinking things that I probably shouldn't be, but a thought is the union fees of healthcare workers. Does that play anything into them seeking help somewhere else? Do you know?
So to answer your first question, the reason why there's only 14 now is because in 2022, we halted anybody entering into it. So the 14 that are in it, which then we continue to pay the 50% of how many licensees can be in it, despite us not. And then for those that are in it, you know, we knew we would be paying for that when the board knew they would be paying for that until when the decision was made, until about 2026 when everybody graduated, because each program is often up to 4 years depending on the situation. So that's why there's only 14. They're the 14 that had already been engaged in it before the vote was to come out. And then the question around union fees, I don't have any, you know, knowledge of what they are doing and what they're not doing with it. But I will tell you that I've been in conversations with, say, Oregon Nurse Association and Oregon Foundation about what they are, how they're going to partner on these topics. There's I think going to be a lot of conversation in the next legislative session, and I think a lot of professional licensees will engage in it.
Marcus?
Yeah, I want to speak a little bit on how I've journeyed through learning more about this program. From where I started, really highlighting that lack of the CNA involvement and coming like 180 around to realizing that it is not a good fit, I think. And I think of when we think about the utility of the HPSP and alternative to discipline, there's sort of two aspects. There's the public safety piece, and then there's the recovery for the licensee and the value that the licensee gets from that, right? And then they kind of come together and have a higher success rate than probation does, where you retain the licensee in the workforce at a much higher rate than you would get through traditional board imposed sanction. And when I think about the first piece about public safety, obviously we want caregivers that are fit to duty and that are not impaired for all of our licensees. When I think about, and certainly HPSP could provide that level of oversight, but when I think about the value to the licensee, the costs that we see here that were presented by Director Prusak don't also include the collection fees. Those can be $50, $80, $100 per lab test. They don't include substance use disorder evaluations. So the true costs per licensees can be $5,000 a year. easily. So, you know, you struggle to see that this framework is a good framework for the CNAs, especially given that cost. And that I'm hopeful that there are other frameworks. So I can tell you, I really shifted the more I looked at this, I really shifted to coming to that conclusion. I think when we've talked about this before, like the problems with the HPSP and what we saw before and what the previous boards had seen as it being a really low value, I don't think was completely accurate or was looking at all the information. I think one of the biggest problems we had was a lack of engagement in recruitment. And I think we can do a much better job with that. As has been presented before, the cost per licensee is really worthwhile. I think it's worthwhile for the public and for the licensee, and is really a national program. When you look, you know, we're one of 5 states that doesn't have an alternative to discipline program for RNs and LPNs. And that's not the company I think we want Oregon to be in when we look at the national success here. I think the other problems were that there is this lack of alignment between probation and the alternative to discipline, and that the alternative to discipline was much more stringent and required longer and more tests than certainly than our probation does, and I think more than the evidence suggests. And so fortunately, these can be changed. These can be changed through the new RFP. They're not set down in stone by statute, so we can tailor that to adjust. I think that's most of what I wanted to say. There's so much here, obviously.
Yeah, and I think, thank you for all of that. You know, yeah.
Really put the plug in, which is considering a peer support program. There's models from other states of great success. New York being one, Rhode Island, Connecticut being another, where they have a variety of health professionals all put in fees towards a peer support where it's outside really the board's jurisdiction, where they have a real confidential space. And I think when we're looking at all the research in substance use treatment, peer support is an absolute and really cost-effective means for engaging folks in recovery.
Yeah, thanks for bringing that up. Couple things. So when we were at the National Organization for Alternative Discipline, we learned what states were offering peer-to-peer. And then I shared on our website, when you all asked to have our mental health resources on our website, the peer-to-peer programs across the country that our nurses can go to while we don't have one. Some states set it up as a surcharge, some states it was for everyone. And I think this is one of the conversations that the board can have as we move forward when we have money versus continuing to surcharge for every little thing, part of that conversation. And then one of the things I wanted to elevate from what you both said, I looked back at one of the other memos I had sent you over this year of talking about this. So while we have 14 in it now, we had 612 over the decade that we were in it. And the success rate, while not as successful as physicians, and there's many reasons to get into that, it definitely had, I think it was 458 nurses that successfully stayed in the workforce from that of the 612. And then I don't know, because I haven't been able to count how many of that between the 458 and the 612 then came to us for probation and then were successful. But it is, you know, when it is offered, when there's that time where there's that education, and the compliance specialists and I are committed to you know, me, every space that I'm in, listening to our meetings with CNOs, meetings with whoever, hey, we're back in this. Hey, we're here. So your workforce as well, and the public is protected. I did ask John to come back up, because I think the big question here with the motion that I added is, does the board take the step of re-engaging now while we are in this RFP process and the statement of work, or do we just wait for that statement of work to be done and start with the next vendor. Now, that next vendor may be Uprise. Who is the vendor now? We don't know because we haven't started the statement of work, and I thought it could be good for for you to just share where we're at, the statement of work, very high level.
Very high level, we've kind of just started. We're putting together what exactly are the new parameters that we're looking for. So based on old contract, we kind of take the old contract and say, how can we improve on this? What were some of the things that we need the new vendor or more information that we might need a new vendor to present to us? And then really go out there and look and see what new vendors are out there and try and get information also from them to say, we might not know everything that you do, so please tell us all the services that you can offer and know. So once we gather all that data, then we kind of put together a team later on that goes through all this data and then tries to pick out the best vendor that meets our needs. They take in price consideration, but they also take in, what exactly the agency or the boards need to operate this program. So that's all happening to then select the best vendor. That's also cost appropriate for the state. So we're doing that behind the scenes. Myself, Rachel Prusak, and other board executive directors to make sure that we have all this contract language in place, make sure we have the best program, and then offer it and see who can.
And can you share the timeline where we're at?
Timeline, we would like to kind of get proposals for bids, I believe, before Christmas. Our timeline was so that we can actually look at the vendors, because that takes a little bit extensive time to go through all their information, grade the information that they're presenting, and then kind of come up with who is the best vendor. That thought process through the committee actually takes a couple weeks to a month, honestly, just to grade a couple of vendors. So we're looking to get this started really soon, hopefully by Thanksgiving, Christmas, to get what vendors we have out there and then actually look into their programs to decide what ones by, I believe, April of next year is the contract.
Yeah, and I think interesting to note too is, as I mentioned, the other boards had been leading on this. The medical board had been leading on this, the statement of work for the process, and then they delayed it a year. And then even though we weren't in it, I got involved in every meeting knowing that there was potential we would. And it is the first time that this has been looked at in 5 years. It's been the same vendor from the same RFP because they just kept extending it. So it's been a really great opportunity to engage on this. And then the medical board director said, Rachel, you seem very invested in this, very passionate about this. Do you want to lead it? And so John and I are leading it, but with the medical board, the board of pharmacy and the dental board. And we've gone through it probably 10 times, and it's getting, submitted now. We're procurement process through DAS, a very public process of what you have to do for the state to say, any agency is looking for an organization, and then they put forward a bid, and then there's a committee to score it all.
So
I have a question, Director Bruce. So if we reactivate this, and even for our 14 existing people, if we find a new vendor, are they moved to the new vendor?
Yes, I asked that question too. So once there's a new vendor, the 14 remaining, and if for whatever reason the decision is to re-engage now, any of those would also.
Part of the RFP process, Board President, members of the board, that is a question we ask to all vendors is based on currently what we have. If you're, even with Uprise, we ask them how they would be able to transition. And that was in the last contract also. If you can't do these services or we contract with someone else, we want to make sure that everyone's taken care of and that the current vendor would be working with the new vendor to make sure everyone transitions smoothly and that no one would be dropped from the current services that they have.
that was my question. I wanted to make sure that we were looking at other vendors and not just re-signing with the same vendor. Other board members?
So, so for now, though, this motion would allow us to re-engage with Uprise. And we would have this as another tool in our toolkit to deal with issues that are brought forward to us.
Yeah, so the real options here, and it's, you know, it's a big decision and it's a big one and you all can, you know, delay, do it, whatever you want to do, but it is me taking the next step and having to work on getting back in with the current vendor. And then still going through the RFP process with a statement of work. And then depending on what happens, what the outcome of that, is it the same vendor, is it a different vendor? Or do we wait until we have the final process done and we know who the next vendor is?
My only concern with that is if we reopen, we'll get more people into this. But then if we get a final vendor, locations are different and things are different.
Mhm.
Does that throw the new people that we just put in a fit of like, well, that's 45 minutes for me now instead of 12 minutes that it was before, and then we lose them. And the just we're trying to do of getting people in ahead becomes, was it really worth it? Could we just have waited to transition and be a clean, smooth transition instead of
Right.
all in and trying to make sure people don't get dropped? So I'll rather, personally, I'll prefer keep this 14 in there and then we see where our future is going and then start engaging with the new people into that program.
I also think that makes more sense. Keep it clean. Let's find out who our new vendor is going to be. Let's re-engage, find the new vendor, figure out where we're going. That way we're not saying, okay, you're going to start here and then you're going to move to here. That's hard on everyone. Other board members?
I also think we need time, given that the recruitment and engagement and community was lacking and was previously, we need the time to do that, to actually build that up. Otherwise, we're still going to be missing it. So I think that taking those steps now to begin to show that this is something we're starting will give us more time to allow the licensees to have a heads up.
But the 14 would be the only ones that would be affected by this if you switch a vendor, correct?
Mhm.
But I guess I always weigh plus and minuses in this. And you can talk me off the fence, but the plus to it is more availability for many verse 14 that could and could not affect location and so forth, correct?
Would be affected either way.
Yeah, the 14 would be affected either way.
But there's 14.
If we,
But then
But how are they affected if they're not in currently?
the other pieces we would be spending. Sorry.
the thing was, if we re-engaged now, we would start putting new people in the program. So all these new people plus the 14 would then be affected. So we were saying it'd be better to wait.
Oh, I see you're saying they may have to move once they're.
Yeah, they're testing locations and
Yeah, no, and I was looking at this and doing the pros and the cons. I was looking forward to the discussion because there is both, and I'm really interested to do whatever the board is doing, and I am committed to also doing that between now and the finalized RFP processes, the education, the collaboration, the word out there that it's coming, right? And also then, okay, but why isn't it now? But it's coming and it's coming right. So it's a tough one, but it's the right conversation you all are having.
Things that you've engaged with though, or that have you already asked questions of different vendors or not yet?
No, so currently it's the finalizing of the statement of work. And then John works with DAS for the procurement process. As soon as the state puts out the process, then people apply, then there's a committee that does the scoring. It's a very fair and just way and public and transparent way for the state so that everybody has fair access to potentially doing the business. But we're hoping April.
I would say a lot of the majority of the work that we're doing now is internal boards, internal Oregon stuff to make sure that the people participating with these vendors are asking the questions. We're going to have the right questions. So a lot of that works we're doing internally to make sure all boards are supported, to make sure all board processes meet this actual contract and that their procedures match up with actually what the statement of work and what, you know, we're requiring from the vendor to give us and the vendor to do. So that's kind of been a lengthy process to make sure everyone's procedures from every board's the same, to make sure that every board is covered with how they do business and how they also put their people into HPSP. So a lot of that work is first now to see what all the boards need, and then once we put that RFP, there's a lot of work to see what is offered, try to make those match.
Just to clarify too, the current cost structure for HPSP is weighted 50% on number of licensees and 50% on participants, correct?
Yes.
Does the board have more discussion? If we have a lot more discussion, we'll need to table this for this afternoon because we do have a lunch presentation starting soon. And we need to get our lunch or are we ready for a motion? All right. And I believe, make sure that we give Director Prusak the correct direction. I believe we want to re-engage, but in the RFP process, but not restart with the current vendor. Is that correct?
I think what I'm hearing from the group is to continue down the path of the RFP. And once we settle on that, re-engage in HPSP.
Yes.
Not to re-engage in the current vendor. Of
Correct.
course, the current vendor may end up being the vendor, we don't know. But so I think what I will ask then is that I think what would be great if it's say y'all's support and encouragement of me letting the public know that once the RFP process is complete for the vendor, we are going to be back in HPSP.
Absolutely.
So to start doing that connection, collaboration, education, outreach with the community to let them know, we know that we've not been in it, but the RFP process hopefully will be done in April.
And so if I'm understanding the motion as written, we would be saying does not approve.
Yeah, and if we want, we could even change it up a little bit instead of saying does not approve. I mean, we could do that and instead modify it and say approve engaging in the active, participation on the statement of work, RFP, and education partnerships with those who are going to be working with us to utilize it. So let's see. The board does not approve nurses having access to current HPSP program while OSBN engages in the RFP process for third-party vendor. I think we can change it up and just say the board directs, and someone correct me if I'm wrong, please yell out. The board is directing the executive director to collaborate with community partners about engaging in HPSP once our procurement process for the new vendor is finalized.
That sounds right.
Okay, give me permission to make a motion.
Will you please make a motion?
Okay. Thank you all for the discussion, and I make a motion that the board approves the executive director to continue engaging on the procurement process for a third-party vendor for HPSP, as well as engaging with the community to inform them we will be re-engaging once that process is done. That was really long.
So moved.
Second.
It's been moved and seconded. All those in favor say aye. Opposed?
Did anybody get my really long motion? I guess we could go back to the recording.
With or abstentions? Motion carries.
Thank you all for engaging in both of those conversations, and I will come back to the rest of my stuff at the end of the day. And you will still get out early.
All right, we will take a brief 10-minute lunch break to go get our stuff and then come back and start our presentation.
Broker today. They provide a software that would connect to our licensing system to aid the board staff with their CE-related tasks and audits, as well as provide our licensees with great tools for continued education as we launch these changes for the board, as we've been talking about. And I think it's going to be something beneficial for you all to learn about to guide next steps. So take it away.
Awesome. Thank you so much, Rachel, and great to be here today and everyone and joining you to share a little more about CE Broker and how we look forward to hopefully helping your board and licensees. Amanda and Marcia Mann will be doing your demo today, as you so kindly introduced us. For the agenda, I'm going to do a quick recap about sort of why we're having the conversation and some of the core areas we'll be able to help support staff as well as licensees, give you a brief overview of CE Broker, and then provide you a demo into our offering. And then no next steps really, but we'll kind of wrap up. And if you have any questions at the end, that's great. I would say for my presentation portion, I'll ask for questions kind of right at the end of that. But for the demo portion, if you have any questions throughout, feel free to stop Marcia and she's happy to address. So great. I always like to start off with our mission statements. I think it's a good framework of what we're focused on and what the priority and lens that we're having this conversation on today. For Oregon, it's all about protecting the public and really regulating the education and licensure of your profession. And when you look at us as a company at CE Broker, we're very similar. We are empowering safe workforces, making sure our population, our public stays safe and everyone is safe and compliant to work. So there's a lot of really great synergy there. And also some of your values, we really value simplicity. I hope that's something you see today in our product and our offering, helping the board collaborate. And, as a company, we're always innovating as well. Look forward to showing that. Now, in terms of the core areas, so number one, we're looking to overall enhance the customer service experience for licensees. Kind of nationwide, everyone wants things to be faster for you, simple, easy to use, electronic if possible, so there's not paperwork involved. And that's what we're offering. So a central repository for everything CE related, providing many of you in the room licensees with support to act as an extension of the board, as well as our mobile app, multi-state tracking, and many other enhanced options there. Also, we are leaning into the overall modernization effort and enhanced services for the board itself. This is a huge trend, again, nationwide. So it's a whole new tool for the board staff as well as licensees, automating processes. So we're saving a lot of time and ideally looking to be a partner to help as you implement some of these changes to make that transition as smooth as possible. And lastly, I know auditing will happen at some point down the line and kind of discussing what that looks like, but we are an audit tool as well. So there's going to be a lot of ways that we can support board staff in terms of what that looks like to increase compliance and make sure they're saving time so they can focus on many tests they have to do internally that are so important. So those are kind of the key points here. All right. For those of you who maybe are not familiar, so CE Broker, we are under a company, Propellus. We actually have 3 brands under our umbrella today that all lean into keeping healthcare professionals nationwide safe and compliant to work and ensuring we have a really safe public and population. We've been around for over 20 years, starting with the Florida Department of Health and still with them today. And our solution at its very basic is a no-cost software plugin connecting to your licensing system that's bringing all stakeholders from board staff, licensees, education providers into the same ecosystem. To make everything simpler for parties, to save time and kind of increase efficiencies across the board. Today, we do support over 250 boards nationwide. Over 5 million licensed professionals utilize are offering, over 350 unique professions and 10,000 education providers nationwide. So really proud of the growth in that time. A few unique elements that might be relevant. So we are no cost to the board to utilize. What that means is no cost today to implement, and even if there's changes in the future. I will go into the kind of business model in a few slides for those of you wondering, so bear with me. And what that does though is create a really good scalability factor that even if things change internally, your licensing system or whatever it might be, we can also remain a constant with you throughout that process, where it wouldn't change for licensees. We also have a lot of industry expertise and are purpose-built for boards. I kind of say them together because we built our solution to solve for what you do for healthcare boards across the country. We connect at a state and national level with licensing partners, associations, the compacts, you name it, to make sure that we're staying up to snuff and on the edge of all the technological advances, and that we are actively a part of those conversations of modernization nationwide. Oops. So in essence, we get you there. Oops, I can't go back. But the last note was support. So we're also going to support licensees in a very unique way that other vendors or systems don't really do, that I'll talk about in a bit as well. On that note, we understand your space. So these are all the nursing boards we support today. Number of logos you see featured here. And Wyoming, West Virginia, North Dakota, New Mexico are on ORBS as well, which I know your board has today. We have a connection already built out with ORBS to make that transition easy. New Hampshire, Wisconsin, Arkansas, and Tennessee Nursing is our most recent nursing board to join as well. So a lot of knowledge about the profession. All right. Okay, for your overview, so it kind of breaks down into 3 core components here. I'm really going to be focusing on the first 2, so board staff and the licensee experience. Providers, it's not as relevant. I'm going to have kind of one slide for you in a bit on that piece. But starting off with board staff, so I'll let the demo speak, but at a high level, we're going to help increase operational efficiencies internally. There's a number of ways you can use our tool to audit, to check licensee CE, get some really great reporting, and more importantly, it's moving all of this to 100% digital paperless process. So a lot of the back and forth that's often happening for staff, we can really eliminate and make it a lot easier on their end to save time. With that, for auditing, we have a compliance API set up, as I mentioned, with ORBS, and this allows a lot of great capabilities in terms of saving staff time in audits and connecting all of licensee data across systems. So what our compliance API does is when you go to renew, it'll ping CE broker to see if CE, if that person has selected CE, if it's been stored and completed. What'll happen is the licensee will get a little pop-up that'll say, it looks like you're done, everything looks great, you can proceed forward. Or if not, it'll say, oh, looks like you might be missing some CE, definitely verify that it's all there, or you could be audited down the line. And this is an example just of what that looks like. It's a little dense, but basically you go to renew, you attempt to renew, it'll say either, yes, you're good to go, and you move forward, or it'll say, oh, there's some missing incomplete components, and then you'll receive a warning, and then the licensee is able to successfully renew. As a call out, just for an education standpoint, we do have a renewal checkpoint where if it's actually not complete, some boards choose to prevent the licensee from moving forward. Florida is a good example of that, where all the CE must be shown before they can continue on with renewal. They saw compliance rates increase from about 3% to 100%. We do see that trend for certain professions, certain states. It's really a kind of a case-by-case basis of what's going to be the best strategy for you, but did want to call it out just as a kind of FYI in what we're seeing. All right. moving to the licensee experience. So we're going to give you one central repository in place for everything CE related. So if you're licensed in another state that we support, you'll be able to track and upload CE for multiple licenses, access courses as well, store certificates, upload them, have education directly reported on your behalf, you name it. A lot of really great things we'll show you there today. The one call out, so I said we are no cost to the board, and which is true. And we work on a freemium model. So there are accounts that are paid accounts that are 100% optional for licensees to opt into that you see on the screen here. So every licensee gets a free basic account. Think of it as TurboTax. You're doing your taxes. You can do everything you need to on the basic level. You're good to go. But if you want a little more resources and support behind you, you're really busy, don't want to really deal with X, Y, and Z, these options are great. So our professional account offers our transcript, which will tell you 0 to 100% how much you've completed, what's needed, what you've done, and even courses that could be relevant to you for those remaining requirements. The Pro Plus, which we just launched this year, mostly because it out of demand. We had many licensees requesting it. This is $99.99 a year. It includes a library of CE courses and no additional cost. So you do that, you can access all your CE, have it reported directly, and you're good to go. And then the concierge account. This includes a dedicated account manager. It's a very white glove premium experience. They'll do anything you might do on your behalf. So make sure you stay on track. They can enroll you in classes, report on your behalf. You don't have to basically report anything manually yourself. We do see, especially, physicians, nurses really love these options, especially if they have multiple licenses. It helps a lot with that. I do want to pause here because sometimes there's questions. Are there any specific questions on the account options? Okay.
Nobody has any questions. Thank you.
Great. We have our mobile app as well. So anything you might do on your computer, you're able to do on the app. And we've actually built out a really great function that if you are self-reporting yourself, you can just take a snapshot of your license and AI will kind of fill it in for you. So you don't even need to take, I don't know, 7-10 minutes filling it out manually, and it can be reported directly. So we're really proud of that function and just continuously trying to make it easier for folks. And last but not least, to touch on briefly, so we've been doing this a while, as I said, 20 years. We have a pretty robust continuing education provider marketplace. So a lot of the providers that, are in your rules that would be acceptable, chances are many of them are on our marketplace already due to all the boards we work with. So what's great there is you can access a course, take it, it'll be reported directly on your behalf. You don't do anything. It's super easy. But did want to call that out as another value add as you open up this option. All right. 2 more slides here I want to share. Just a quick note on implementation. We're really easy to implement. I'm sure others have said that, but I swear hand on heart, we do about 85-90% of the lift for you. So it takes about 90 to 120 days on average, and we'll do everything for the board, for the staff, scheduling the meetings, confirming your rules, configuring, testing, and even then training. So you feel really supported in that transition. We have, materials and samples of what other boards have done, great ways you can promote this on your website or in a newsletter. So you're not starting from ground level. We're doing a lot of that work for you to sort of help you get there faster. And then usually it's just about a 2 to 4 hour commitment from board staff for verification, training, etc. So fairly easy there. And last but not least, so customer support. We offer this for licensees. It's really unique. I've been doing this over 10 years. I don't think I've seen this quite often in my career, and we're really proud of that. So 8 a.m. to 8 p.m. Eastern, Monday to Friday. We have live chat as well as email support available for licensees and building out a knowledge center for your board specifically. So anything CE broker related, if you have troubles with the account, you have questions for this, we can field that and take that lift off of board and the board staff. Nice little benefit there. As a side note, the board will also receive a client success manager who will manage the entire relationship and time you're with us. Marcia is one currently and has been with us for some time, so she can speak to the role. And they're really wonderful to have a touch point. If you have a change, if you have a question, board staff is supported as well. All right. While we transition our screens here, are there any questions on anything I shared I can address while we do that?
It doesn't sound like it.
Okay, wonderful. Well, I'll let Marcia take over here and put a visual to everything. Thank you.
All right, so I am logged in as a licensed professional. As Amanda mentioned, we have a couple of different account options. I'm logged in as someone who's using our professional account just because I wanted to show you how the transcript works and how that can help them make sure that they have met all of their CE requirements. But for someone who chooses to use our free basic account, they're going to see pretty much the same screen that we're looking at right now. When they log in, they're going to see this dashboard. Their license number will be here at the top. It will tell them whether they're complete or not complete with their continuing education hours. The one thing they won't see in this box is there won't be a percentage. It'll just tell them not completed in red if they're not done, or if they are done, they'll have a green check mark and it will say that they're complete. So that's the big difference on this page. This percentage won't be here if they're using the free account. And then as we scroll down, every licensee has this view. They'll be able to see a list of all of the courses that have been reported either by the licensee themselves or by an approved educational provider that's reporting on their behalf. So they can see a whole list of all of their courses. If they choose to stay with the free account, we're going to give them a link right to the board's website where they can look and see what their requirements are, and then they can just manually compare that to what's in their course history. So they can just add that up. As Amanda mentioned, it's kind of like a TurboTax thing, you know, like if you're just doing the easy form, then the basic account might be all you ever need. So we do give them as many tools as we possibly can to make sure that if they want to do it themselves, they can figure it out. But if they do choose to have the transcript, then that gives them a little bit of help. So before I go to the transcript, I kind of wanted to just go over this screen specifically. As Amanda mentioned, we are in several states now, and we work with quite a few nursing boards. So if I have a license in Oregon, and I'm also licensed in another state that is utilizing CE Broker, I could just add that additional license here. So when they click on this drop down, it gives them the option to add a new license. So as long as it's a license in a state where CE Broker is working, like maybe they're licensed for Kansas or Arkansas or Tennessee, you know, any of those boards, they could add that additional license here. And then when they log in, one login, one password. And as you can see, I already have a Florida one here. They can toggle back and forth, and we'll spell out the requirements for each of those licenses to make it really easy for them to manage that information. And then if they're looking at their course history and they just want to, you know, see some of that information, they can just click on this little drop down and it'll give them the course information. So this is one that was submitted by the licensee themselves, and it tells you, you know, it's posted by Jane Doe. They'll be able to see any documents that they uploaded, any questions that they might have had to answer as they were self-reporting. And these are customized based on what the board would like to have answered by a licensee. So this is totally customizable. And then, as I said, their documentation would be here as well. If this had been reported by an educational provider, it would say the name of the educational provider here, and there wouldn't be any questions because the provider is reporting on their behalf. So we have that third-party attestation. If they need to, they can download a PDF of this. This comes in really handy if maybe they're licensed in another state and they want to share this course history with that other state. Maybe that state doesn't use CE Broker. They can share their course history with them. They could share it with an employer, what have you. So it makes a nice little PDF that they can use. And this just continues to grow. So we don't actually I've been here 21 years. We've never purged anything out of our course histories. So we've got some licensees that their course history is multiple pages long. So they can always go back and pull that data out. And that course history stays there no matter what kind of account they have. So just keep that in the back of your mind. Even if they decide they want to use us for free, they're still going to have access to that course history. And we've given them some filters. So in the event that they do have one of those course histories that's really, really long, if they only want to see the courses that were posted in a certain date range, they could filter it that way. If there's a specific subject area that they only want to see, they could filter it that way. So it makes it easy for them to manage that course history, especially if it's a pretty intensive one. And then the compliance status, the CE compliance status, is always going to reference a specific cycle. So we tell them, hey, you're not complete, and this is the cycle that you're not complete for. So they don't have to think, oh my gosh, it says I'm not complete, but I just renewed my license 3 weeks ago and my new cycle started. So, we try to make sure that we make it as clear to them as we possibly can what data we're actually displaying. Are there any questions on the dashboard piece?
It doesn't appear so.
Okay, so let's go to the transcript. So the transcript is where we're going to tell the licensees how many hours are required, how many have been applied, and how many they still need. So in this case, I'm looking at a Play Georgia nurse, and they're just have general continuing education requirements. They don't have any specific subject areas. If I were looking here for a New Hampshire nurse, for example, or a Michigan nurse, I might see that I need implicit bias training or professional ethics or human trafficking. So if your board had certain subject areas that they wanted the licensees to complete, those would show as separate categories here on this transcript. Georgia only has 30 hours in general. They don't require any specific CE, so that's why you only see that one bucket here. But if they needed additional subject areas, they would all have their own bucket, and it would show, how many hours they need in that bucket and how many they've completed. And then if there's anything that, maybe could be confusing to the licensees, we can put that information here on the transcript messages. I specifically am using Georgia because I know your board kind of has this as an option where they could do continuing education or they could do other things, or you're looking at maybe making that change. So Georgia is very similar to that. So they can do continuing education hours, or they can do other things. So they could maybe report their employment hours or their certification hours. So if you have those kinds of things that could confuse a licensee, we can put that information for them on the transcript, and it'll spell it out very, very clearly for them, what kind of funky things might be happening. For example, we have some states where they only need a certain requirement every other license cycle or every third license cycle. And that can be confusing for licensees to keep track of. So we put that information here just to kind of help clarify that for them. So let's see, I'm missing some continuing education. I still need 20 hours of CE. So let's say I have some continuing education and I want to report it. Maybe I've gone to a national conference or something like that, and it's a provider that's not going to do the reporting for me. I would just click on Report CE here at the top, and then it's going to give them the specific categories that they can report under. These are also built out based on your board's requirements. This is just Georgia's requirements, so they can do either CE. actually, this is just the CE option. This one just gives them the ability to report a whole bunch of things from one provider. But then if they had one of those other categories that I was talking about, they could click here where it says additional options and just choose the cycle they're reporting for. And then they could report one of these categories. So there's a rule reference here that we can put in. So if the licensee wants to know, what does maintenance of certification mean? They can look at the rule reference. What does verification of competency mean? They can look at the rule reference. All of this is all built out based on what you all accept and what the requirements are. And then if something like this is reported, it would meet all of the nurses' continuing education requirements. So I have seen some boards that don't allow anything but continuing education. And then I've seen some that have a whole bunch of choices. So we can meet either need. Just wanted to make sure that you understood that we could customize that based on, what you need to have. So let's go back here. And let's say I want to just report some continuing education. Again, under the Learn More, we're just going to give them some information. We can give them a specific rule reference if you believe that's helpful. We can spell out for them right here what educational providers are accepted, how the providers have to be accredited. That's what this is for Georgia. And then we can even get so specific as to tell them things that aren't accepted if there are things that you don't accept as continuing education. This is always a biggie on the job orientation, or some boards don't allow continuing education unless it's at least 30 minutes. So that kind of information can be super helpful for the licensees. If they have a certificate and they're like, I'm not 100% sure I can use this for Oregon, we can give them that information. And then under the how to report, it's just going to tell them the questions they're going to have to answer. So in addition to telling us the date you completed it and how many hours you completed, you're going to have to tell us the name of the activity, who provided it, how that provider was accredited, and then they're going to have to attach documentation. This is all built out based on the board's requirements. So there could be 15 questions here if you feel that's relevant, or there could be one question here. It just depends on what information you might want to see when you're doing an audit. And then we're going to give them that attestation statement that they have to swear, this information really is true. And again, this can be as robust as it needs to be, or it can be just a basic, I hereby certify the information I've submitted is true and correct. So let's say I'm going to report something. They can use the calendar, or they can just type it in. Put in the number of hours I completed. And then they come to where they have to attach their document. We won't let them continue without a document. So they must attach a certificate of completion. So let me just attach document. And then they have their attestation. And they get a message that their credit has been submitted. From here, they can report additional CE if they'd like to, or they can just go back to their transcript and they can see the hours. And this one's cycle ended January 31st, 2024, which I should have paid attention to that. So the course that I reported for September 2024 is not going to show here, but it will show here on my course history. And it just gives me a little message that says, oops, I reported something that didn't fall within my biennium. So it just gives them that little message there. Any questions on the reporting flow?
Doesn't look like anybody has any questions.
Great. As Amanda mentioned, we are rolling out the ability for a licensee to just scan a certificate And our system will read it and fill out all those pieces that I just typed in manually. It's not super labor intensive to just type it in manually, but using that scanning capability does save a lot of time. So, you know, it's reading the certificate, it's verifying that it's a certificate, and the licensee is looking at that and like, yep, this is all of the information. And then they just click submit and it reports it right away. So if they need to find some continuing education, they can just click here where it says find courses. Now the course search is available from our homepage. You don't have to be logged in to CE Broker. You don't need to be registered in CE Broker. The difference is from the homepage, you do have to tell us what state you're licensed in and what profession you are. I'm logged in as a person right now, so it's just taking me right to the course search for my profession. So all of these are educational providers that are accredited in a manner that Georgia will accept. The licensees can choose if they want to look at live courses. Maybe they want to take something in person. They can certainly choose that. We're going to default to self-paced because in today's world, it seems like that's what people want to take the most. But they could change it certainly if they're looking for a specific, maybe they only want to see computer-based training or correspondence courses. They could filter the list that way. If they wanted to search for a specific course, you know, maybe they're looking for something in a specific topic, they could do a keyword search. If they're looking for something from a specific educational provider, they could search by provider name. And then if they have elected to use our Pro Plus account, which does include courses, they can click this button and it's going to pull up the whole library of courses that are included with their subscription. So all of these educational providers will report in CE Broker on behalf of the licensee. A lot of them will report right away as soon as the licensee takes the course. Anything with this Take It Here button, it gets reported immediately as soon as the licensee has completed it and their certificate is uploaded. So it really closes that loop of, you know, hey, I know I need to take continuing education. Where can I find it? So we're providing that for them so they don't ever have to like go all over the place and try to find continuing education. Is it approved? Is it not approved? Let me ask the board office. We're providing that for them to really make it easier for the licensee. And then the last thing is our support center. So if they have any questions while they're utilizing CE Broker, this little question mark is at the bottom of every page within the licensee's account. And they can use that to look at all of our FAQ articles. They can use that to chat with a representative. We have live chat available Monday through Friday, 8 to 8 Eastern time. And then also email is available as well. So is there anything in the licensee's account that you have any questions about or you'd like to see more of?
I had a question. So
Okay.
assuming a licensee has different licenses in the same state, does it list it separately or does it just put it under like Oregon and then list subset of what they have?
It would be the same as what I was showing you just a second ago. So let me go back to my screen. So I just specifically said nursing, but like if they had another Oregon license and it's a board that's using CE Broker, it doesn't have to be a nurse. Like I'm just going to use Georgia since that's where I started. For example, in Georgia, we have nursing, we have massage therapy, we have dentistry. So if I was a nurse in Georgia and a massage therapist in Georgia, I would just come in here just like this and add that license and still one login and one password. And I would see the transcript for my massage license. I would see the transcript for my nursing license. If I'm searching for courses as a massage therapist, I'll see the massage therapy courses. I'll see the reporting options that are specific for massage therapy. So it just like here, so like if I were to go to Florida, for example, my transcript's going to be different. So it's unique based on what profession you are. Did that help?
A little bit. I guess I was just wondering, like, if someone has an MP license and an RN license under the same board, does it separate that
And does it move the transcript back and forth to say it's under the same board?
So there are two separate professions. It's not like an upgraded license. Am I understanding right? So it'd be like if I had an LPN license and an RN license.
Yeah, but then the RN and the MP one are working concurrently at the same time. You're using both actively.
Do they both have the same digits and different profession code? Is that how it works? So
No.
they're two separate. Okay, so yes, they would have just two separate licenses listed and they could go back and forth.
And the transcript will move back and forth to say the transcript
Yes.
qualifies for this one and that. Okay. thank
Yes.
you.
The only time that wouldn't be effective would be if they're using the same exact credentials. So if an RN upgrades to an APRN, for example, their RN 99999 might become APRN 99999. And in those cases, then yes, there wouldn't be separate transcripts.
In Oregon, the RN and the APRN are different license, different numbers. So, but you are saying that it would be within the same account and you could
Yes.
see both and they would, oh, great.
Yes.
Yeah, and just so since we're coming to time for the board to be aware, CE Broker is at National Council State Board of Nursing every time I'm there and have asked to speak to the board. And most recently with board president and I there, met with them. They've done a presentation to some staff and wanted them to come to present to you, knowing that as we update our rules and really embrace CE, that we could potentially have this opportunity to partner.
Great. Any other final questions? I know we have a minute or two otherwise.
Any additional questions? Doesn't sound like it. Thank you for the presentation.
Absolutely. Thank you so much for your time, letting us join you during lunch today and attention. And yeah, if there are any other questions, feel free to reach out to myself directly. We can probably coordinate something there. But thank you again and have a wonderful rest of your Thursday here. We look forward to continuing the conversation and, potentially supporting you in the future.
Thank you.
Thank you.
Director Prusak, I do have a question for you. Is there anything that's being used currently?
We do not have anything that's being used currently to offer any of the licensees to track CEs or us audit CEs. So this would allow for both and can be for further discussion at a follow-up board meeting after today.
Thank you.
Of course.
All right. So hopefully we'll have that on one of our upcoming meeting agendas to discuss that further. We'll move into our open forum. As of right now, there's only 2 people signed up. I want to remind everyone that during the open forum, due to lack of public notice, the board will not discuss or deliberate on any topics that are discussed in the open forum, and that I, as the board president, have the authority to stop an individual's comments if during the course of the meeting this exceeds this authority. Each speaker will be allowed 5 minutes to present. And I believe I'll just start from the top. We have Ann Warrenson. Come on up. And we have fancy new microphones, so you just have to push the button once and it'll turn green and then you can talk.
Hello, my name is Ann Mortensen, and I've been a nurse for over 25 years, working in the areas of pediatric ICU, emergency, and adult ICU previously. Now I'm currently a forensic nurse or a sexual assault nurse examiner and an instructor at Portland Community College. I am here concerning the faculty at Portland Community College. Deficiencies were found in the spring of 2023 that caused the faculty to be overloaded and burned out and increase faculty attrition. To remedy this, PCC administration committed to hire at least 3 more faculty to give 25% release time to all faculty and adjusted workload to lab and sim and clinical faculty. Fall of 2023, the workload was improved, but this release time and adjusted workload has not been continued. Most of the fall faculty assignments right now are very heavy workload. For example, my assignment that I'm encouraged to take has a 12-hour clinical group, 14 hours of lab, and 5 hours of sim most of the weeks of the term. So that leads me to 31 hours of student-facing time. My contracted hours are 35 hours. I'm also supposed to have 5 hours of office hours, need time for prep, grading, college service, and much more. It's very difficult to do all of that. I'm also mentoring new faculty in that space. Last year, I had 14 hours of student-facing time to be over the lab, and I still worked 35 plus hours a term. Besides workload issues, the other issues that are not being kept with the commitments are hiring of full-time faculty. It was promised 3 positions. There is 1 more faculty than there was last year, instead of these 2 additional faculty that were promised. And we will also have an increased cohort of 8 more students. Also, we had a problem, especially last spring when 2 staff went on leave, that more faculty or other staff were not hired and the workload was just distributed. This caused a lot of burnout and difficulties so that we were not able to appropriately plan well for this fall. And there were also communication in our department is not always professional, collaborative, and in a timely manner. This has affected a lot of part-time staff so that they, some have decided not to come back, and we're having difficulty having enough staff for all of our clinical groups. We as a faculty would appreciate if OSBN would encourage PCC administration to keep their commitments and improve the workload and preparation and support of faculty to provide the best education for our nursing students. We know that there have been visits, but we appreciate if the faculty at Portland Community College could be spoken to and express our views. Thank you very much.
Thank you. Wait for my timer to reset. Next, we have George Gilchrist from the Oregon State Hospital.
George Gilchrist, thank you. I appreciate this opportunity to speak before you today. My name is George Gilchrist. I work as a nurse educator at Oregon State Hospital, but I am not speaking on behalf of or representing Oregon State Hospital or Oregon Health Authority in any capacity. Additionally, this year I was a member of the Rule Advisory Committee for Division 31 of our Nurse Practice Act, and I'm currently proud to serve in the same advisory role for Division 21. I'm not speaking on behalf of either advisory committee or in any official capacity. I appreciate that the mission of the board is to protect the public by regulating education. And I'm here to advocate with deep concern about health outcomes for hundreds of thousands of Oregonians who experience mental health conditions, and particularly the patient outcomes of tens of thousands who experience a severe mental illness in our state. While the nursing shortage is frequently an industry conversation, I also would like to draw your attention to the extreme shortage of psychiatric nurses in Oregon and a severely challenged psychiatric mental health nursing career pathway. Nursing schools do an amazing job of preparing their students with foundational knowledge and skills of nursing, fundamental and important skills that prepare them for medical or med-surg nursing practice. And and I can say with certainty that they are missing a big part of health. Because without mental health, there really isn't any health. If somebody, well, there is health. If someone is struggling with mental health or experiencing a psychiatric illness, their own self-care will suffer, and they are less likely to be able to follow or seek medical advice. In most circumstances, people don't seek care for good reasons, and every medical care interaction in any setting, positive or not, is accompanied on some level by at least anxiety or grief or depression. And maybe more significant mental health conditions as well in any setting. If we're preparing students to work as med-surg nurses and we do not provide Oregon nurses with basic skills, and we are really selling the public short, in addition to nurses. Mental health and psychiatric illness are not consistently or thoroughly integrated into Oregon nursing medical care curriculum. Nursing schools are provided with a lot of flexibility to develop their curriculum, and they should be. But there are no rules in place that require nursing schools to teach specific subjects or create curriculum specifically about psychiatric or mental health concepts. And anything to do with mental health or psychiatric illness is loaded with systemic bias, and it is just it's a tragedy, and people are not getting the care they need from our nurses. Some nursing programs are more focused on mental health and psychiatric nursing concepts, but if Oregon nursing schools are primarily focused on the tasks of med-surg nursing, placing catheters, starting IVs, monitoring post-op care, and on, it makes sense that their students would graduate and go to work in a med-surg setting. Nursing school is when aspiring nurses are forming their ideas about their patient care practice and their own professional nursing practice. For years, I've been having conversations with nurses at my hospital and anywhere else I get a chance about their psychiatric nursing education, because mine was horrible. And I wanted to see if it was better in other places. And according to those nurses, there is no consistent, robust, integrated psychiatric mental health nursing education. And I see I'm out of time.
You have one more minute.
Okay. To the chase here. I ask that the board considers that there is an ethics rule from the state that prevents state-employed nurses from being clinical faculty and working on their campus that they are employed on. If I am a nurse at a state facility, I cannot go clock out and go to work and bring my students back to the environment that I'm an expert in and be able to teach them. I also appreciate that I am out of time. Abe, thank you so much for this opportunity to speak. It really means a lot. And it's not the last you'll hear from me, I'm sure.
Thank you.
Thank you.
If I may, just really briefly, Mr. President, have the privilege. So I think you all know that anytime somebody is trying to reach out to you all, I share with them that this is the way for them to be able to share and always invite public comment, public forum for this time. So I'm always grateful when people show up and take the opportunity when giving them the opportunity virtually or in person to do that. And we'll just make a comment that the last thing George shared is something that the state is focused on. The Board of Nursing can't fix, but the state can, and he's been in conversations with them on it.
I don't think we have anyone else that wanted to speak during open forum. Are all of our schools here? We will turn it over to policy analyst.
Can we take a 5-minute break? Thank you very much.
Take 5. come back together and we'll get started. I believe we're starting off with our first education.
All right. Good afternoon, Mr. President and members of the board. I'm going to direct you to page 123 of your packet, where you will find a memo describing my survey of Blue Mountain Community College's registered nursing program, as well as the survey report and updates from the program. And I'm joined today by the nursing administrator. This is Lori Post, and she drove out from Pendleton to be here today. So when this survey was conducted, it was very apparent how important Blue Mountain's program is to its overarching institution and really the community that it is serving. And what also really stood out was the dedication of the nursing faculty and its administrator in supporting and running this program. So within my survey report, you'll have noted that for all of the relevant standards in Division 21, that the registered nursing program was either meeting or partially meeting the standard, and that in the areas where I identified something as being partially met, I felt that the program was meeting it sufficiently enough to recommend continuing approval. At the time of my survey, the program was given recommendations for how it could fully meet the standard moving forward. And because this survey was conducted back in May, the nursing program has actually had time to take steps in addressing some of my feedback. So I'd like to offer you the opportunity to ask any questions of either of us.
Board members?
I have a question on your fiscal resources and maintaining the adequacy in those. Can you comment?
Well, there were a few areas that were noted. Fiscal resources were low. One areas in the budget was lab supplies and maintenance of equipment. And I will be meeting with administration soon. And the program assistant and one of the faculty that orders lab supplies and keeps up with the maintenance of equipment will be getting together with actual costs and we will put that forth to the administration to increase the budget. What's interesting is the budget doesn't show necessarily what Office of Instruction actually covers. We get what we need from administration. So we don't feel, except in the area of maintenance equipment, that we've done without. So they have been supportive of whatever supplies that we need or any extra outside of the budget. And then as far as faculty, I think that was one of the areas. We had one faculty member leave at the end of winter term, the end of March. We hired a temporary full-time faculty member who was a seasoned 17-year educator, and she helped us finish out the year. And we actually had 2 full-time vacancies. And our union and administration got together and supported a 40 and 45% increase in the salary for nurse educators.
Mm.
And then we were able to get some applicants, and we were able to hire 2 full-time nursing instructors this summer.
Okay, I'll go again. On clinical faculty visits, can you comment on that?
Yes. Clinical site that Laura visited and talked with, we totally dropped the ball with that one, with making regularly scheduled visits. And we weren't even following our own policy. And our policy states that we will visit clinical sites in person with the clinical faculty or the agency and with our students. And so we've talked about that, and we are very dedicated to continuing our policy.
Can I add to that? Our policy in Division 21 is that for these community-based clinical sites that it is meaningful presence, which I know is kind of a vague term. And so I think interviewing the site, they felt connected to the program, like they felt like they were getting like adequate communication, but they weren't really seeing the faculty as much. And so it was really just highlighting for Lori and for the program that it sounds like there's there's communication between you and your clinical site, but you really want to maybe step up and have some in-person interaction with them.
Other board members? All right, I think we're ready for a motion.
All right, Mr. President, members of the board, my recommendation was in my survey report, the full approval for this program. And so I motion that Blue Mountain Community College's registered nursing program be granted continuing approval as presented until May 2032.
So moved.
Second.
Been moved and seconded. All those in favor say aye.
Aye.
All those opposed? Recusals or abstentions? Motion carries.
Mr. President, members of the board, I'd like to next direct you to page 146 of your packet, where you will find a memo regarding the closure of Health and Education Consultants, LLC. And I have an update regarding this memo. I had a notification very late last week from the program director at Health and Education Consultants. She has decided to continue to reevaluate the closure of this program. And so essentially at this time, she is not planning to close. So I need to pull this notice and no board action is needed on this item. Okay. All right, Mr. President, members of the board, next I'd like to direct you to page 147 of your packet, where you will find a memo describing a letter of concern the board received regarding Portland Community College's registered nursing program. And so I'm joined today by their nursing program administrator. This is Adam Wright. And as I shared in my memo, we received a letter of concern from Portland Community College that is signed by 6 faculty members, some current, some former. The letter spoke to specific standards in Division 21 that the faculty felt the program was not meeting. And as noted in my memo, it generally falls around program organization, administration, faculty, and curriculum. Also noted in my memo, we received a letter of support about Portland Community College, actually praising a lot of the work they've done in the last 2 years since OSBN last surveyed their program. So I am bringing this to you today for guidance. When business related to a nursing program is discussed with the board, we typically invite the nursing administrator and alert them of the public memo that I gave to you. I am certain that you have questions, and ultimately what I need the board to consider and discuss today is whether this is something you would like us to investigate further and authorize a survey to actually conduct that investigation.
Board members?
Before I ask any question, I just had a clear, never mind.
Okay.
Let's start.
Okay.
We
This is
only
the
got the one page.
I said 147. Is that?
I mean, we're a page off.
We're
but-
a page off.
Oh,
Or
okay.
page off.
My question is, the letter of support you received, who were they from?
It was from a nursing faculty also within the program.
So we have 6 nursing faculty that signed the other letter, and how many signed the letter of support?
6 faculty who signed the letter of concern, some current faculty, some former, and I do not know the breakdown specifically. And then the letter of support was signed by one faculty.
Do we know if the one letter of support that was signed by the one faculty are they full-time, part-time, or PRN?
Full-time.
Thank you.
Is there work that is being done currently to address the concerns of the 6 faculty that shared concerns? And can you share with us something about what is being done?
Thank you, board, for having me here today, and also members of our faculty are behind me in support. Yes, we are doing things to address the issues that were brought up in this complaint, as well as the original complaint. In 2023, PCC was visited by the Oregon State Board of Nursing with a short list of items that needed to be addressed. Since then, college leadership went into action and it started addressing them right away. One of which was the organization and administration of the program. Immediately, the program's leadership was restructured into a dean position, which is now me, the first dean of the program, to help with retention and also increase the pay gap that is recognized with nurses in the field versus academia. And then also since my arrival in late October of 2023, we have actually been able to increase our nursing faculty size, in particular with additional part-time faculty and the hiring of full-time faculty. I will say that of the full-time faculty that have made themselves less available to the program, none of them have actually resigned. They've gone on to pursue other life options, either pursuing their doctorate or not the right time, or just maybe taking a step back from the program for now until we get some of this sorted out. We've also added a faculty department chair, who is the author of the letter of support. This person is designed to support the faculty with additional tasks. They get 50% release time to do that work in support of the faculty. We've strived to maintain a 35-hour work week for all of our faculty, maintaining the agreed upon workload from the federation or the union. We do not exceed a certain number per term. We've reclassified our administrative assistant from a level 2 to a level 3, adding more responsibility and also allow us to take on the reinvigoration of our CNA program. And then also in an effort to support all of our faculty, we do have 4 lead positions. We have 2 clinical leads, a skills lab lead, and a sim lab lead, each of which will get 25% release time each week, which amounts to about 8.75 hours per week of release time to attend to their curriculum and their planning and things like that. Every faculty gets 5 hours a week of office time as well. As far as the curriculum, on our last visit to PCC, most of this was met, except for there was one gap in that we did not have a dedicated simulation expert. We have since filled that role. They are entering their 2nd year as our simulation expert and lead, and they will also get release time to build that simulation lab for us and is working towards certifications.
Just for my clarity, I'm going to make a little summary and you could correct me if my assumption is wrong. You restructure workload so that it can go to some other job. But at the end of the day, the faculty is still responsible for those workload.
If I understand your question correctly, yes, the faculty is responsible for their assigned workload.
But then you restructure so like the chair can take 50% workload in case they need to fill in for someone. Your lead position can take 25% workload in case they need to fill in for someone. But if they're not available, that faculty that is ultimately responsible for that still has ownership of that. So if the chair is like, oh, I'm helping Stacy today, I can't help Jonathan today, Jonathan still has to figure out how to deal with his workload. if someone can reword that.
Yeah, let me jump in and clarify. I think Mr. Wright is speaking to release time. And so when he's saying there's a 25% release time, there's a 25% reduction usually in your teaching responsibilities. And so the teaching workload does decrease because you are given time for other assigned duties. Does that help?
Yep. It's restructuring, basically. Okay.
And I'll add, that's part of their overall workload, that release time. It's not in addition to or above what their assignments are. That is mathed into their workload balance.
Thank you.
I have two questions. One to policy analyst Blackhurst. When the board, when you do the or it wasn't you, I guess in that case, but when the surveys are done, they look at student satisfaction. And I'm curious kind of what that may have looked like over time, as well as for the dean. Sorry, I forgot your name already.
Adam Wright.
Sorry?
Adam Wright.
Adam Wright. But just how the student satisfaction and feedback has looked, if that, how that parallels.
I appreciate that. We do, when we conduct a survey, we absolutely interview the students who are available to us. We don't necessarily, within our rules, have a threshold for satisfaction, but you know, a program has to have policies that are current and fair and published. For students, they have to know that they have support. They have to know how to find that support. So I don't know that we specifically, when we survey a program, are looking at some measure of satisfaction. But we do definitely hear that in the interviews we conduct with the students. They let us know how satisfied they are. To that end, however, I do not know what the students reported at the 2023 survey.
I would speak to the trends.
In my short time, I'm on 11 months or going on 11 months with the program. I engage with students on a regular basis. I am pretty much in their space. I really do value that feedback because it's important to me to understand the position that the program is in. Majority of the feedback I get is the students are overwhelmingly positive about their experience in the program. They actually see a change in direction in the program. As a matter of fact, it was brought up not long ago in a faculty meeting where students have given feedback to our part-time faculty that they feel as though the program is in a much better place and is leading towards, you know, a brighter future, kind of being the cornerstone program in nursing program in the state. So I get a lot of feedback from the students, and it's overwhelmingly positive.
Another different area, thinking about, I assume the faculty, both the temporary and the more permanent faculty, are salaried. And then, so how do you evaluate the hours that were expected when you spoke to the 35-hour kind of FaceTime with students piece versus the responsibilities that like, how do you survey and follow up on whether their work, the amount of hours that they're putting in per week reflects that expectation of the 35 hours?
That's a really good question. I'm going to answer it to the best of my ability. It's kind of an honor system. These hours that were agreed upon are that of the Federation. So we make sure that the faculty are assigned workloads that do not exceed 35 hours per week. That includes their release time as well as their office hours per week. I don't necessarily go around and ask our faculty, what did you do this week? Are you over or under? We try to calculate the math based on how much time they're spending in front of the students. So for example, if a lecture is 2 hours and they meet twice a week, that's 4 hours of student facing time, and then so on with simulation and skills and the clinical assignment. So these hours start to kind of pile up on each other. I do my best to make sure that our faculty are averaging about 21 or less hours per week. Some weeks will be greater than others because there are more things to do. We don't have sim every week. We don't have clinicals all through the term. So some weeks will be lighter than others. And think I might have, is that answering your question? The other part, when you mentioned salary, is that we've actually taken an extra step to ensure that all new full-time faculty are starting at a step 3 salary, which is just shy of $80,000 a year. We recognize the gap. And with the support of our pathway dean, we were able to have the college approve starting our nursing faculty at a higher rate, just so we can lower our attrition and increase our retention. Our part-time faculty are assigned an hourly rate based on their assignment. So if part-time faculty has a 90-hour clinical, they will be given step 3 hourly, whatever's been negotiated with the Federation for 90 hours plus office time and prep time.
So I have several questions. One, I might not be privileged to know, but I'm just curious. When you have the one letter of support, my question in that is it somebody that has been there for years? Is that a newer member? Can you answer that?
Again, that's a good question. So a lot of our faculty are new, myself included. I think our longest faculty is just entering their 4th year with the program. The person who wrote the letter in support is our faculty department chair and is going into their 2nd year with the program.
And then, so I'm still on. On the flip side of that, I guess the 4 letters of 6 letters of concern or were those seasoned, meaning they were faculty that had been there quite some time?
I do not know who penned that letter.
Yes, I did not share with the program which faculty had a concern.
Okay. I'm a director. So when I see something in regards to, like, that's great that there's bullet points out in regards to some of these concerns. The first one that hits me is the program doesn't have enough faculty when they need to take leaves. Obviously, unhappy staff makes everybody unhappy. But what is the plan for when somebody has to take a leave of absence or so forth? Is that something that's already been addressed or that we have a right to know?
Sure, I believe you have a right to know.
So can I jump in here for just 1 second only because I want to just remind the board. So based on the last question of anonymity, so as we know, we have a complaint process. We have a process for how we do investigations, and the way that we handle our complaint process when it comes to faculty is a survey by a policy analyst. So I'm not saying that the board can't continue to go down this route, but that really is the best tool for not only the board, but for the faculty. So just wanted to put it out there that is what really is our tool, and it helps everyone engaged and involved in it.
That helps, Rachel. It's the first time I've been through this. Let's go to my last question then. It says, obviously, that there was in August 12th of 2024, there was, since that notification, the enrollment dropped. Is there only the one statement in here about the University of Portland? Pardon? Oh, sorry. Okay, I'm done with questions.
You know something I don't know. You did ask, I'm sorry, you did ask a question about is there a plan for covering shortages? And there is absolutely a plan to cover shortages when people are out. We've hired several additional part-time faculty who are, and more are coming actually, to are more than ready to support the program.
I appreciate all your responses very much. Really, truly appreciate it. In the fairness of the staff members and due diligence of what we do, I feel it is worth it for an investigation.
I agree. I was like getting ready to hit the button going, we.
That's what I was trying to get to.
Yeah, I think in light of.
I believe the board would like to direct a survey be done of the program at Portland Community College. If we could do we need a motion for that? If we can hear a motion for that.
Yes. Let me also clarify for the board. So PCC is due for its routine survey anyway in April. And so in doing a survey, I would like to do a full survey of the program, not just a focused survey on this issue. I think that means if everything is positive when we survey, that we wouldn't have to then come back again in April, which is hard on the program for us to survey so close together like that. So I would also, before I make a motion, like to confirm with the board a timeline for how rapidly you want this program surveyed. Again, it is work on the program to sort of get ready for us to arrive. So if you could give me just a little bit of time frame, is this something that needs done by October or November? That would be.
Does November give you guys enough time?
I have a clarifying question.
Absolutely.
To the board. PCC had been surveyed in April of 23, and we were slated originally to go out through to April of 27. The revisit or follow-up survey was scheduled sooner for April of 25. I'm curious if this additional survey would then push or take precedent over the April 25 survey that was supposed to happen.
My records are that the program is due in April 2025.
Okay.
For the continuing approval survey.
I'm still learning. Does the school have to prepare, like in physical therapy, you'd prepare a self-study report? Does the school that is a very long process. So November is, I don't know, I feel like that's pushing the timeline. This is a giant document. I would give the program some grace for that.
I'm going to echo that a little bit, give a little, I guess, a little pushback to the other board members. Because, yeah, the survey was done last year, and I think that there's some very serious issues and concerns that are put forward here, but I'm a little reluctant to push that timeline to a shorter. I feel assured that we've already planning on that follow-up survey in the spring of next year. And I don't know, I think that there's a lot of workplaces that have issues, particularly in nursing, with staffing and with working conditions. And I'm reluctant to push that time frame closer. I think that we have a good process, and it sounds like the program is really focused on assuring that the students and the faculty can improve their state. And I don't know what really pushing that timeline sooner is going to do to improve that.
If I may, I agree with Mr. Cooksey. I'm absolutely open to a survey. I'm absolutely open to a revisit. I do think that a shorter timeline would be disruptive to our students in particular. I am, and this program is dedicated to making sure that we are doing well and meaning well by our faculty. I would plea that we move past maybe the holidays so we can have time to prepare.
I do have
Sorry, go ahead, Margaret.
I have a question in that how long is the typical preparation for a survey visit?
Varies. I have had nursing program administrators tell me that it was a chunk of their workload for a semester to prep for us. It is a significant amount of work to develop a self-study, exactly what board member Keelis referred to. There's a lot of evidence the administrator has to put together.
So in reality, what we're looking at is to give them adequate time to prepare. We really are looking at that April date. Or maybe March, but it's not going to be a big difference.
I know that historically the board has authorized surveys that were conducted on short notice. But again, we are already scheduled to survey in April.
There were quite a few complaints that people felt strongly enough that they sent letters. They got a hold of former and current staff to sign on to that letter. Is it worth are we doing them justice, making them wait another 8, 9 months before we even look into this for them? And I mean, then what if we do find some serious issues or deficiencies? I mean, if we look into it sooner, maybe there's no issues, maybe there's no deficiencies. We can put the whole thing to rest sooner. And everyone's good. And I'm not saying we have to do it in November, but we could do it like December, January. It doesn't have to wait until April per se, but there's enough concern that current and former faculty felt strongly enough to get together.
I have a question for policy analyst Laura Blackhurst. So hypothetically, could we do a short version of the full survey before it's the full survey time?
Hypothetically, yes, we could do a focused survey, but we would still have to survey again in April for the full survey.
Hypothetically, could April be moved to mid-year or July if we did a focus survey? All hypothetically.
Previously, the board had voted to grant PCC continuing approval until April 2025. And so pushing the survey later, the full survey later, pushes them past that window that we've given them approval.
This raises the question. You're doing the survey. Does that mean that in April you'd be coming to us?
Typically, I do the survey. I don't necessarily bring it to you the same month that I do the survey because just however long it takes me to write a report, and then the timeline of when that happens versus when does the board actually meet again. And so, for example, we just discussed Blue Mountain, which was surveyed in May, but because of sort of the timelines of when the board meets, I was not able to bring that to you until September.
So although the survey is due by a certain date, that means that it's disconnected from when it comes to us.
Yes.
And so if I may one more time, just hearing everyone, it isn't just it isn't just a lot of work for the school, it's a lot of work for our staff. And I think that's why the request was to do one. And how do we do one and when do we do one? And it sounds like the next couple of months are really intense to prepare for it. So, you know, we don't want to wait till April, but what do we want to do so it's before April and only once?
So following up to my question, is it possible to do it in such a manner that we are seeing it in April?
I believe that is definitely possible. Again, that would mean for PCC that we would need to come probably at least 2 months prior.
Members of the board, I encourage you to come visit and survey our program. I'm confident in what we've done and where we're going. Frankly, I would prefer it to be earlier, but again, it is a lot of work for yourselves and myself and college administration and our faculty as well. You probably won't see a lot of me while I'm preparing it. So having not yet started the fall term, we still have a little bit of work to do, and I would welcome you back in February.
Let's shoot for February
All right.
for a full survey.
All right, and I'm prepared to make a motion on this.
All right, your motion.
Thank you. All right, I motion that the board authorize a full survey of Portland Community College's registered nursing program to be completed by February of 2025.
So moved.
Second.
It's been moved and seconded. All those in favor say aye.
Aye.
All those opposed? Recusals or abstentions? Motion carries.
Thank you. All right, Mr. President, members of the board, I'd like you to direct you to page 148 of your packet, although it sounds like I might be a page off. 149, okay. There you will find a memo describing an enrollment update from the University of Portland. And this is another item where I need to provide you an update since the memo went in the packet. So I had the opportunity to visit University of Portland last week. I was conducting their routine survey visit for continuing approval. And while I was there, was given another update on enrollment. So their enrollment has dropped further since that first letter we received in early August, and then the later update I was able to provide in the memo. At this time, their program is not anticipating needing further clinical resources. And so essentially the issue that I was going to ask for guidance on has been resolved. And so on this item, no board action is needed, but I'm happy to answer any questions you have about it.
I guess when I was reading it, it said since official notification enrollment dropped to 282. So I was like thinking it was from 270 to 282, but it was from 288 to 282.
Do they know why their enrollment's dropping so much?
You know, their curriculum is a little different than a lot of nursing programs around the state. Most nursing programs, you do your prereqs and then you apply to be in the nursing program. They have a true 4-year curriculum where you start as a college freshman. And so, you know, college freshmen sometimes choose to go to a different college at the last minute and not notify you, or they get there and they change their major. And so they tend to see a little bit more fluctuation in their enrollment numbers right at the start than a lot of other nursing programs.
Okay, Melania. Good one. All righty.
Right. Mr. President, members of the board, the final item I have for you today, I believe is either on page 150 or 151.
51.
Packet, 151. There you will find the memo and really a preliminary application for a new registered nursing program from the Institute of Technology. And so I'm joined today by their nurse administrator, Bonnie Olson. As I noted in the memo, all of the requirements for a preliminary application were met. There were 2 letters of concern, which were included in the application in your packet. And then IoT directly received a 3rd letter, which they also included in the packet. And so we are happy to answer any questions you have about the preliminary application.
So I have a question. This is being asked on behalf of a board member who's not here. So in the application for the program, it stated that their program would be 9 10-week terms, with 2 of those terms having a clinical component for terms 8 and 9. Is that the only clinical exposure the students will have?
No, that is the initial, when we started building it out, is community health in term 8 and out in, like acute care in term 9. But I would like to also include kind of how we do our LPN program, to where they would go out sooner, like in their 4th and 5th term, also getting out and getting exposure to clinical practicum sites instead of just those last 2 terms.
Okay, because she also stated that if it is just those last 2 terms, it's a bit concerning that that wouldn't provide the students an opportunity to meet the minimum competencies.
Correct.
And it would be a lot more challenging on them.
So I mean, with the developing the program, I would like to include how we do in our LPN program that they go out for their clinical practicums out sooner. And then they will also have those focused ones at the end.
Okay, thank you. Other board members?
I know I had a question, but now I'm trying to find it. This has to do with clinical placements and the availability of them. And I thought I read in one place that they were supposed to be within 50 miles. And yet at the same time, if I'm remembering this all correctly, this is supposedly remote and going to serve people in underserved. Am I recollecting this correctly?
For the clinical practicum, the 50 miles is in our policy. We have that they have to be placed within 50 miles of the school. But if they're a student that is like from Southern Oregon or, you know, Eastern over in the Bend area, we try to find clinical practicums that are closer to their homes, so they don't have to travel so far to go to their clinical practicums.
Okay, so there's
Yeah,
a
and
little disconnect.
yeah, and let me add to that point as well, that I think this is referring to their programs policy, that 50-mile radius. Our rules actually don't specifically say that clinical has to be within 50 miles.
And so they can get approval. And will the school help them find those sites that are within 50 miles of where they are?
Yes,
And,
we do.
and vet those organizations? Because what I've been hearing over the last year is there's a real concern about clinical placements, especially in that particular area, the availability of them, and if there are enough available. So that makes me apprehensive about this program.
I think, yes, I know the board has heard from many different sources about clinical placement issues. One thing to consider as well, this is a preliminary application, and so it can also be very difficult for programs that are not yet even through the preliminary application to secure clinical sites and have concrete evidence to provide you about clinical. And I don't know if that's been your experience.
I mean, we have been very fortunate. I'm just gonna talk for our PN program of finding clinical sites in the areas that students live. We have been very fortunate. We have affiliation agreements with many different facilities down in Southern Oregon, Eastern Oregon, over on the coast, to where we can place them close to where they live. We have been out just going to different facilities, even now talking with them about the different programs and that. And of a lot of the program places that we went to were long-term care centers. And a lot of the long-term care centers are also interested in, you know, hosting RN students. Instead of it just being in a hospital setting, they can get their experiences in other areas as well. So we've been reaching out to different ones, but it's, like Laura said, it's hard to secure a site just yet because we don't have the program.
My concern is the impact on the existing and their ability to provide the services that, we've approved them for already.
Can I say something on that one too? And on one of them, what I did with looking at different things is like with our Chemeketa Community College, they do their practicums on Mondays and Tuesdays. So we would like to, if we get the permission to do this, to develop and have our practicums, clinical practicums on different days than what they do theirs. So we're not, to lessen that impact on the already established programs. Because I did look at Chemeketa and some of the other ones, and their clinicals are, like I said, Monday, Tuesday, where we would like to use different days of the week, so we're not impacting their programs.
Other board members? No?
So this is just a preliminary. You haven't reached out to clinical placement sites yet, or have you?
We've been out to different clinical placement sites, just seeing what availability is out there,
Uh-huh.
you know, and would they be interested in hosting RN students if we did develop a program? And most of the sites that we went to, I don't think there was one site we went to that told us, no, they would not be interested in hosting RN students as well.
Did any
as our
one of
LPN.
them give you a letter of support of what they might be able to take from you
We
in
do
terms of
have one,
numbers?
I did include one from Kaiser Permanente. Kaiser, the individual that we deal with at Kaiser Permanente has said that she could, you know, give us placements from Portland to down as far south as they go, that we could place students within Kaiser Permanente as well.
Can I add, I'm looking through their application in the packet, and included in the packet are a letter from Kaiser, a letter from Avamere, and Salem Transitional Care. So they did include in their application
Mhm.
letters of support from different healthcare systems.
Maybe I missed this in the report to get an idea of where OIT is at right now with the LPN program, like roughly how many?
Pardon that?
With the current, there's a current LPN program for OIT. Roughly, how large is it? How many students are in it?
We can have a maximum of 180 students in our LPN program.
And roughly, how many sites are you already partnered with?
How many
that?
sites do we have? Oh, gosh. I'm gonna say at least 50 that I know of.
I imagine that is a kind of a core piece of what you're looking at for RN clinical partnerships.
You know, I'm just thinking of going through the spreadsheet. There's at least 50 of them listed different sites that we can go to.
So I think this is distinct from a program kind of picking something up from scratch.
Right.
We've seen elsewhere. It's different licensure, definitely. But I mean, yeah. Yes, there is that piece too.
And they do have, like Marcus said, they have some partnerships already set up with their other programs. So it's not like it's a brand new program with no partnerships established yet. Are there other questions or comments for?
I'm just gonna ask a clarifying question, not to assume. Are you intending to partner with the same sites that you have your LPN programs with?
We do intend to, and we are going to intend to try to enlarge who we can, you know, clinical practicum sites, but we will go with some of the practicum sites that we already use.
So my guess is you're not at max capacity with those ones currently.
What's that?
You're not at max capacity of how many students you can have with those sites currently.
No, and our clinical coordinator does it very well. Of most of our clinical sites that we use, we only place 2 to 3 students there at each clinical site. We don't overload the clinical sites with students.
Any more questions? All right, I think we're ready for a motion.
All right, then on this item, I motion that Institute of Technology's preliminary application for a new registered nursing program be approved as presented.
So moved.
Second.
It's been moved and seconded. All those in favor say aye.
Aye.
Aye. All those opposed? Recusals or abstentions? Motion carries.
Thank you.
All right.
Thank you.
Do we feel like we want a break? Yep. All right, we will take a little break. All right, we are back. We are going to pick back up with Executive Director Prusak, picking up from Delegation Authority, I believe.
I think we have, the behavioral health and substance. Delegation. That don't need. So, recenter. As you know, we play a crucial role in delegation of practice that's been over the past year. I've been asked, as I've acted, I would look back at minutes, branding, to ensure that the board had transparency. I did bring them to the board, review and discuss. Fortunately, I did not include all of those in the board packet. So we are going to update delegation. But what I'm going to do is I work for it. We went back. I wanted to make sure, yes, authority, are the policy, are anybody else that was written down. Good education or to know of. But the one that I. Does that, okay, good. I don't need to repeat. Okay. That's okay. So picking back up where I was on, the delegation that I really want to focus on today, one of them is one that was given to me, or rather the executive director on June 18th, 2009. The board delegated the authority to grant extensions of due dates for board reports to the executive director. And I want to look at that full memo with you. Since I'm requesting that the board delegate authority to grant extensions of due dates for the board reports to the executive director, the investigations manager, and the support investigations manager that will be joining us. So let's go to that memo, which is on page 199 in the paper packet, so maybe 198 in the online packet. We there? Great. And I know I've talked to you all about this at some point in the last year, but in 1997, SB 235 was introduced to take steps to assuring that we have timely resolution of our complaints that are sent to our health licensing boards. And the bill, which is now codified in statute ORS 676.165, underscores the crucial role of the board in the investigation process. It mandates that all complaints received by the board must be investigated, with the investigator required to submit a report to the board within 120 days of complaints being received by the agency. Importantly, the statute stipulates that the day count begins upon the receipt of the complaint, not upon assignment. ORS 676.165 allows for 30-day extensions if the investigator still not completes the investigation, determine if a preponderance of evidence exists that there was or was not a violation of the Nurse Practice Act. The statute does not describe the number of extensions allowed. Therefore, after the initial 30-day extension, if a preponderance of evidence is not established, or if there is another reason the case is not ready for the board review, we can just continually do 30-day extensions. I wanted to add in that in 1998, the AG opinion states that although the investigator does not necessarily need to complete the investigation within 120 days due to the extension clause, the investigator's report is due within 120 days or the extended period must be more than a mere status report. The legislature provided no consequences if the investigation report was not made promptly. And while there are no consequences, Oregon State Board of Nursing intends to be timely with investigations, but there are many mitigating factors that go into a case being open for extended period. And I know that you have been interested in what some of those were. So in October 2022, we had a change in data system. This really did impact licensing and investigations. We've had staffing changes over the years. We've had staff take medical leave. And of course, I'm listing things that we are not the only agency that are going through this, but it's just always great to remember as we think through the impacts of workload. So times to get assigned, how long it takes to get assigned to an investigator, larger caseloads leads to slower investigations. It takes time for us to receive our records. More and more in the last few years, it's taking a really long time to receive HR records or any kind of medical records. Sometimes there's ongoing criminal cases and we don't bring them forward due to that. And sometimes a case sits because it's going to a hearing. I just wanted to elevate some of the work that's been done over the last year. There's been a reasonable faith effort at improving the efficiency and thoroughness of our investigations, as opposed to just kind of creating that illusion of compliance by just saying, check, here's a 30-day extension. When I arrived, I did a gap analysis to really determine the backlog of complaints, ensure that all cases were labeled appropriately, and we improved our intake process. And as you know, and you heard earlier today, we're right-sizing the investigation department and the staff. And we've really looked at how to cross-train our administrative staff in the investigation department to really support efficiency. So getting back to the delegation authority, the law allows the board the decision to grant delegation of this 30-day extension. And in 2009, when I went back and looked at the minutes, it's only delegated to the ED. Now, that may not have always been the practice. Sometimes I'm learning in agencies, the ED then delegates to a designee. And so, as you know, I was also the investigations manager for a while since we've been here. Thankfully, we have Erin Ferris that has arrived. But what I learned about these 30-day extensions is that it's really a full-time job. We have thousands of cases and extending them is a full-time job. And so thankfully, we'll be having the support supervisor manager joining us and really be on top of our cases to ensure that the 30-day extensions are done in a way that, again, the law, there's no, one of my first steps that I wanted to do is really update the statute when we were going to the legislative session next year, but I learned that that is a huge lift and it was going to be quite impossible. And I don't think anybody was going to be up for me opening that statute. So it really is just how we as a board handle it. And I have reached out to all the other boards that kind of do this. Of course, they don't have to do it to the amount we do it. We have the most licensees and the most complaints, the most cases. So therefore, what I'm really wanting to do after discussing the matter and realizing that I'm not going to be bringing anything forward to change this statute is to really state my commitment to following this process, timely and efficient investigations, but I really need the delegation to be executive director, investigations manager, and support investigations manager. And of course, that is what I'm hoping we can update. I can make a motion and update for the delegated authority. And I do have investigation manager and Ferris here with me. For any questions for me or her?
I have two questions. One is, it looks like approved pre-licensure petitions was lined out.
Oh, so that's on another one I'm going to bring to you. Yeah.
Am I in the wrong
Yeah.
place?
Yeah. So the 30-day extension one is what we moved to on page 199. And then when we go back to the discussion around delegation, I will elevate that one. Sorry for the confusion.
So when you were talking, I thought you listed 3 other roles besides yourself. 2. And it's just, okay. Yep. So I misheard that.
Yeah.
And I was like,
Yeah, so a lot of the ones when I looked back during the minutes was like executive director or designee. I don't think we should have our designee. I think we really need to spell out what the designee means. And make sure those that were designated have that now that I'm here.
I'm good.
Any other questions on this one?
What is the average amount of time or median amount of time? I know, giving you that eyes, what, do we know that, for investigation to be brought to the board from complaint?
I don't have that data in front of me to be exact, but I can tell you it's really dependent on so many variables, from the availability of the records, as Director Prusak mentioned, the availability of witnesses, the availability of the respondent themselves to provide written statement and or participate in a recorded interview. I would say 6 months to a year is probably pretty close to our average timeline. Ideally, working closer to 6 months versus.
Yeah, and I have been over the last few months digging into some data because I'm being asked to present at, say, the healthcare workforce last week, or the healthcare committee Monday in the legislature for interim committee. And it's very interesting because they're always asking about licensing times and application times, and I really want them to ask about all of this. There's one section that they're asking about numbers for suspension, which I'll be bringing to them. But what it did was I really dug into how I can run some reports and work with the Erin Ferris on this, and I can bring that back to you in November because it's something that I really want to dig into, what it was a year ago, what it is now, and what it can be once we are right-sized and staffed and have the processes in place. Okay.
All right, any other questions on this one? I think we're ready for a motion on this one. Or do you want to do them all together?
No, I can do them separate. I think for safety of everyone, me not having some long one like I did last time, let's keep them separate. And get back to the right spot. Okay. So the board approves a modification for the board to delegate authority to grant extensions of due dates for board reports to the executive director, investigations manager, and support investigations manager.
So moved.
Second.
Been moved and seconded. All those in favor say aye.
Aye.
All those opposed? Recusals or abstentions? Motion carries.
Great, thank you. And so now I'll go back to page 196 or 195, where it talks about the other updated delegation. So on September 20, 2012, the board confirmed the board staff has delegated authority to approve application petitions that meet requirements, submit complex cases to the board for board direction, approve pre-licensure petitions, assess and determine the need for a civil penalty or discipline for student, faculty, and or preceptors, engage in an unapproved clinical practicum, in addition to not counting clinical hours toward certification. So this really goes to some of the stuff that we talked about in the training about nurse education, and how we do investigations, how we do surveys. But again, here it really, it says that the board confirmed the board staff has delegated authority. And as I mentioned, this whole kind of designee is something that I want to have clarity on, so you all know exactly who's doing it. So therefore, really, this update is requesting that the board confirm the board staff that has delegated authority is the education consultant, and the delegated authority is to, and the only reason that I removed approved pre-licensure petitions is it really is redundancy to that first approve application petitions that meet requirements. That's approving pre-licensure. So I just felt, right, like, do we keep it? Do we remove it? Either way, it's fine. I'm not saying we're not going to do it anymore. It was just a redundancy. And as we've talked about, we're trying to clarify everything everywhere we possibly can. And so this was just another step. Was there anything else that I missed that you would want to speak to that? Since you're the one getting delegated authority if they vote that way?
No, I think that covered it. It really was that the primary petition that we approve is the pre-licensure petition for out-of-state nursing programs to do clinical here. So it was redundant language.
Thank you. Yeah, I really took this delegated list that you will all see, and maybe we'll do it in October, but it can be November. And everybody that was doing the role, I said, is this what you're doing? Is this how you're doing? Do we need clarity? Do I need clarity? Does it need to be someone specific versus just designee? And so that's the work that you'll see when I get the entire list to you.
And so this falls on Laura
Currently.
currently, or your role, and
Mhm.
there's one of you.
Mhm.
Okay. Um,
I have administrative support to help me with these petitions.
because my next question was going to be, should the executive director also be added to that? Would,
I mean, if I ever go to one of these, it would be with them. I am not in any position right now to do those. Maybe one day I will, I've wanted to go along to one so that if ever needed, I could do one. What do you think? Do you think it needs to be there or? I'd rather not take ownership of that. Wait till you see the delegated list.
It's very long.
Yes, since 1999.
That was my sense that you did not want
No.
to be doing these approvals.
I really look forward to the day that I can join. They've always invited me. I really want to learn. I want to see. It just hasn't happened yet.
Okay.
But thank you.
Bring a colleague to work day.
Yes, yes.
Any other questions or concerns? I think we're ready for a motion on this one too.
Great. Okay. The board approves a modification for the board to delegate authority to the education consultant to approve applications, petitions that meet requirements, submit complex cases to the board for board direction, assess and determine the need for civil penalty or discipline for student, faculty, and/or preceptors engaging in unapproved clinical practicum and not counting clinical hours towards certification, and remove delegated authority to approve pre-licensure petition. But again, it's in there by saying approve application petitions that meet requirements, not that you need to vote on that as part of the motion. I just needed to, for some reason, clarify that once more. We're all on the same page.
Yes.
Okay.
so moved.
Second.
Been moved and seconded. All those in favor say aye.
Aye.
All those opposed, recusals or abstentions, motion carries.
All right, and so we'll be removing from this the approval of the full delegated authority list from 1999 to 2024, and I'll bring it back. I'll add these two that we did, as these were just the only two that really needed significant now updates, and the other ones I'll bring forward for you all to see. Okay. All right. Do we have next attestation model language? Great. So on April 25th, Corey Feist presented to the board on the work of Lorna Breen Foundation. After the presentation, the board discussed how to proceed and requested that I find model attestation language that meets ADA requirements so Oregon State Board of Nursing can remove the broad and invasive mental health questions from our licensure applications. Presented here is attestation model language being used by licensing and credentialing applications. I did a lot of research, whether through with the Lorna Breen Foundation offering me what other states were using. This is what I came up with, and I can, share it aloud here. So it would state, the Oregon State Board of Nursing recognizes that nurses encounter health conditions, including career fatigue, burnout, mental health, and substance use disorders. Oregon State Board of Nursing strongly supports applicants' efforts to address their health concerns and ensure patient safety. Voluntary options may include seeking medical care, self-limiting the licensee's nursing practice, of voluntarily self-referring to the Oregon Health Professional Monitoring Program, a program dedicated to assist and support the recovery process, including achieving and maintaining optimal physical, mental, and emotional health. The failure to adequately address a health condition where the applicant cannot practice nursing with reasonable skill and safety to patients may result in the Board of Nursing acting against the applicant to ensure patient health and safety. And then the example would be, I attest to no current physical, mental, or behavioral health conditions that currently impair my ability to practice. So in reading this, I do know that there is a problem because we are not currently allowing self-referral into HPSP. And so how do we word it? How do we update it before that with a goal of having it updated for the new year without having that? I don't know. Do we say when applicable? I don't know. Reading it out loud though, after the vote today, it made me realize, depending on the timing, do we wait to remove the questions until we're back in? Do we keep this statement but remove that one part? It could say, or self-referring to alternative to discipline program, right? And then
I was gonna say, we could also remove HPSP and add Oregon Wellness Program. Maybe, or
more broad.
We just be more
Broad.
broad and say referral to treatment programs and maybe parentheses and like
which might
equals
include
alternative to discipline, Oregon Wellness Program, and then it can allows for that evolution over time.
Yeah, because what if there's then peer-to-peer? What if there's then,
They would
so,
tack it on.
yeah.
I like treatment programs. It's good. Other board members?
Is this model rule language or statutory language? Just for clarification, thank you.
So this is basically, I don't know how to answer that. Let me think for a second. Right. I need to think for a second of how I'm going to answer it. Not that I don't understand the question. So our statute isn't telling us that we have to ask those mental health questions. And in fact, the recommendation now is that we don't. So there's nothing that we have to do. So this would just be us following up on the discussion of what do we do if we remove the questions from the applications, and the attestation model being used by medical boards and other credentialing boards is this. But it's nowhere that we would have to open up any of our rules in anything. Is there anything you guys are thinking on our applications? What does it say in Division 31 that we?
Well, this is on our application that we would be updating. There is some language, and Ella could probably speak better to it about in statute about, don't want to misquote it. I don't have it right in front of me.
Yeah, and we could come back again. You
Yeah.
guys asked me to find an attestation model. I found one. We don't necessarily have to vote on it today. It's several months before it's going to be kind of the IT fix. And then maybe if it is in rules, so I can come back and think more clearly through what it is connected to.
Rachel, so we're not going to change the verbiage, but can we remove the one part then and then come back to it? And
Yeah.
then my second question in that is, if we do use that, and I like the words there, it seems like we're coming back, can we come back and put peer-to-peer things? Of
Yeah,
that?
you can always do that. Yeah. I mean, and then once I figure out, is it in a rule, how we have to do it. But what I do know is that I don't think right now there's any barriers to updating this. And whatever it is, we'll open it up. But really what I wanted to do was finally come back to you guys with an attestation model language for you to further help me decide what it is that you want.
I really like this because especially if we can get this on the renewal applications, then as nurses and CNAs, and everybody's reading through their renewal application, they'll start to realize, oh, it's okay if I seek help. As long as it's not impairing my practice, it's good for me to seek help.
Yeah.
I have an hypothetical question. I have a lot of those today. So what if the person selects no and they attest to no because they're renewing their license in a timely manner and don't want to lapse, but they know they're not going to practice currently? What happens? Like if they were renewing? If anybody knows the answer to that.
Like if they say no, they do have a
Yep.
physical, mental, or
But they
So
just
right
renewed their
now, it would go
license.
to the investigations manager and the investigations manager, excuse me, the licensing manager, and the licensing manager meets with the investigations manager. And we make a decision on, does this person get a license, or does there need to be an investigation from some self-disclosure, whether the self-disclosure is substance use disorder, mental health illness, or that they, some criminal activity. Do you want to speak to that a little more?
I was gonna also suggest the alternative. So there's probably scenarios already where people are saying no to the questions that are on the application, asking about physical conditions, et cetera. At the point that a complaint comes in, post-renewal, post-initial application, we do look at what the initial disclosure was, just to compare the information we have current to what was disclosed or not disclosed at the time of the application. So I don't know that that would change, even with changing the language in the application. There would still be a reason to reference the attestation for the purposes of investigation. And that might not answer your question.
So is there an option I decline to answer this question?
They could choose to not check the box, correct? An attestation.
No, but
No,
they
have to, they have to.
they
attest.
have to attest.
They have to
So I think
attest.
what I'm gonna do is, this is why we keep having this conversation, is I need to figure out if there are any barriers in our statute, our rules, what we have to open up, removing and being more broad about HPSP specifically, and then what happens. But you have to attest. And, going back to that conversation, that was what was one of the things that was important. And I remember, Nikki, you were one of the first persons who vocalized, like, not just like removing it completely, but having an attestation model, because it was part of that ownership of, oh yeah, I need to take care of myself. And so I think if I can go back and get some information, policy analyst rules over here, legislative liaison statute, and go back to other boards and ask how they're handling it. But right now, when somebody answers yes on a disclosure, we further look at it.
I was gonna say, it seems to me though that we need to have them the ability to say no to this. Because if we're forcing them to attest to it, whether it's true or not, then it's just to check the box. If
Well-
there's no way for them to essentially opt out and say,
they can't opt out. They either would have to say, yes, they are physically, mentally, and behaviorally able to practice, or no, they're not able to practice safely.
And not get
Right.
my license.
so we're forcing them to not renew their license.
Versus.
They can't attest to this,
Mhm.
then their license application or renewal ends right there.
That's an interesting point. I will,
and it should.
Nicole at the Oregon Medical Board has led this work when AMA asked all medical boards to do this. So I will ask her how that came up, because she did this. And I will ask all the other boards of nursing that are working with the Laura Breen Foundation to do this. I think there's only 3 thus far that has gotten the kind of stamp of approval and has officially done it. A bunch of us are working on it. It just takes time.
And
You were gonna
then
say
it-
something too, though?
Of course, I'm always playing with language, right? So I would say on that example, ability to practice with skill and safety would be I don't know, in my opinion, a good ad. Clarifies that you could just practice. You might not be
Right.
good.
With skill and safety. And I think the other thing, which I think Ella was about to speak to, is just because somebody says no or answers yes to they're not able to practice, doesn't mean that they don't get their license. It just means it goes for investigation.
Yeah.
Yeah, and it also sounds like there's some questions. What I'm hearing from the board is there's some questions I think that need to be looked into further before we're ready for a decision. So I think maybe the best course of action at this point is to allow us to take a look at these things that you've raised today and bring this back in the future.
Yeah, I'm excited to, I mean, that's the thing, to do these things right, it's a process, right? Like all these things that I wanted to do on day one and it's, day 365, like that's okay. Things take a while. So I just want to take notes real quick, even though I know it gets recorded about the one thing.
This is exciting.
It's very exciting. Yeah, and Oregon will be one of the first. It's taking a while for everyone. We wanted one of the first 10 skills. But it's about getting it right, not being first.
Right.
More broad. Rules and statute.
Maybe use treatment.
Yep.
Don't you have to, if you, I guess, it's been a while, don't you have to say, if you're saying yes, then isn't there an area where you explain?
Yes.
And I think this is something else to look into further
Yeah.
as well. Thank
If
you.
if you're not attesting, what do you explain and then how does that happen? Yeah. Yep. Yeah, I mean, better to figure it out now than after it's on there, on the application.
When I was doing my renewal at lunch and during the renewal, it tells you if you're in HPSP, you answer no. So
Yeah.
it does prompt you during your renewal for some of that stuff.
Which will be great when we're back in HPSP. Not just the 14 people. Okay, so no motion on this either. What I'm gonna do is more homework and come back to you all. Yeah, great. Thank you for that discussion. Then why don't we talk about the behavioral health and substance use disorder monitoring? Of course, I'm not gonna be coming to you all on page 192 or 191. I won't be coming to you all with every policy and procedure as we update them here, and they're all getting updated or created rather. But I really wanted to bring this to you because this is setting the stage for the work that I've been doing with investigation manager Erin Ferris, as well as the 3 compliance specialists working with a consultant who's, really been leading this work. And what we've done is research across the country and figure out what is best practices. And as board member Cooksey mentioned earlier, the way that we did have it set up, if you Google HPSP and Oregon State Board of Nursing, it really shows why we had a decline in people going into it. You have something at 4 years and you have something at 2 years. So probation was 2 years, twice a month. HPSP is 4 years, twice a month. And side to side, I think Marcus might be handing it down because he printed it. And I've elevated that a couple of times. The many reasons why I think the decline might have happened isn't just that. It was a trend across the country, except for the states that had those really good collaborative partnerships with the hospitals and had a really strong education arm of the program and being in the community, which is what we plan to do. So this, though, really is the kind of basis of what we're building the many policies and procedures off of in compliance to really do that start. And one of the things I really wanted to highlight is we've been really thinking on best practices, looking at states and looking at data is what shows to be successful, and making sure that our length of monitoring and our probation is equal to the length of monitoring in our alternative to discipline program. And best practices is showing that a diagnosis of mild substance use disorder is for 2 years, and a diagnosis of moderate or severe substance use disorder is 3 years. And when you look through the policy, it really does show, how we'll manage it. And then the next conversations around the policy that are going to build on this is, what do you do if somebody's completed 1 year and has been great and they can't afford continuing twice a month? What does it look like if someone's been in it 3 years, but should probably still stay in it longer? So you start with this 2 years and 3 years and build off of that. So just wanted to show you and be really transparent, because the goal is every single policy for our compliance specialists, everything that's probation and alternative to discipline is going to be on our website and transparent. I don't know how many states are doing that, but it's one of the ways we've been learning from the states, is from the states that are posting it to be transparent. So that's the goal for us. I don't know if anything stuck out in that policy that anybody wants to comment, appreciate the direction, say we're going in the wrong direction.
This is really disheartening,
Yeah.
you know?
Well, it explains why we're here.
Yeah.
I'm enthused that we're looking at adjusting the amount of testing to be a little more evidence-based. I think that traditionally a lot of people just assume, well, more is better. But at what cost? At what cost to the licensee? At what cost? And now we finally, thanks to the National Council, we actually have some evidence about when someone has a full year of monitoring, that they've got it, and it's been a perfect monitoring, like nothing aberrant, no red flag tests, that their chances of success are extremely high, and that's a point at which we can look to decrease the frequency of monitoring and continue to be monitoring and randomness there. But we're really capturing and being cost effective, I think, which will play into the licensee's engagement. Because currently, what I hear anecdotally, what the national experts say is nurses are seeking treatment outside of alternative to discipline, or they're falling into their use getting so severe that it becomes discipline. And so we're really missing in between.
Yeah, I know when we did our research, and on the board, Marcus is one that's been sharing with me what he finds. But it really is starting with that twice a month testing, and then also having it not only be random, but different types, not just urine. When do you use the other types of testing?
There's like at-home testing, virtual testing now, which can be especially good for alcohol use disorder, especially good for people in rural sites that don't have access. Another thing I want to elevate again is the idea that because the fees for collection are important, and so collaborating with hospital organizations that maybe their employees could figure out a way to get that waived, to be able to get the testing done, could save a lot of money. Yeah. But again, it's about partnering with the healthcare organizations and employers.
Yeah, I just this week had a conversation with 2 experts about home monitoring using swabs. When is it helpful? When is it not helpful? So that'll be in a policy coming soon to a board meeting near you.
All right, any additional discussion? All right.
Well, I'll really thank my compliance specialist staff who are working hard on this. Christine Barrington, Nikki Boquist, and Leslie Kilborn, and our investigations manager. We are digging in to really get this program to be what I hope can be a national leader.
Thank you guys. You guys put in a lot of work.
Yeah. All right, and I'm going to close with the listening tour.
Yeah.
Okay. If you want me to. I know I've been asked and it wasn't on the agenda. We could just leave and nobody hear about the listening tour.
Use all those resources.
All right, let me just pull up a few of my.
I don't know if we can because we didn't notice for it. for the meetings law.
Yeah, but we've added agenda on all the time. If someone asks, if they ask me to add on agenda item to talk about my listening tour. I mean, I won't if I can't, but we've added items and removed items. Sorry. I can tell you guys in October. Yeah, no, yeah, I can tell you guys in October about this thing that I even wrote about in paper and sent it in an email. I can wait. We'll make her feel more comfortable and we'll wait. Listening tour in October.
Wait for
Okay.
October.
Okay.
All right. Our next meeting is October 16th at 4:30 will be virtually, and the Oregon State Board of Nursing meeting is adjourned at 2:56 p.m.